This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority.
Welcome to today's meeting of the Housing Committee. Members of the public might like to follow along at London Assembly on social media and use the hashtag London Housing for this meeting. Please may I remind participants to silence your devices. Our main item of business today is rough sleeping in London. Before we begin, we have a few short items of business. Can I now ask Clerk Paul Goodchild, if any apologies have been received?
Thank you, Chair. Apologies for absence from the Deputy Chair, Assemblymember Moema.
Thank you.
Sorry, could we also Assemblymember? Oh no, sorry.
Declarations of interest. We now come to declarations of interest. Can I ask the committee to note the recommendation set out at item 2 and ask if members have any other interest to declare? Great. Can I ask the committee to confirm the minutes of the meeting held on the 20th of January and 9th of February 2026 to be signed as me as correct records? Agreed. And can I ask the committee to note the completed and outstanding actions arising from the previous meeting? Great, thanks for bearing with us, panel. It brings us to our main item of business, rough sleeping in London. Can I please welcome our first panel of guests? Jess Turtle, founder and co-director of the Museum of Homelessness. Greg Hurst, Director in Communications and Public Engagement at Centre of Homelessness Impact. Sophie Bubis, Head of Research and Policy, Homeless Link. And Gillian Thursbury, Service Director at St Mungo's. We've got a number of questions we want to come to you with, and I know you're with us for about an hour and a half. The first one is my kind of opening and setting the scene. So I only come to you for kind of a couple of minutes each because we have got many more questions that dig in. So I know you're going to be really keen to share things, but you will get an opportunity throughout the session. So as a broad opening of setting the scale of rough sleeping in London, what factors have driven the recent rise in rough sleeping? And how acute is this compared to other areas of the country? Jess, I'll come to you first, if that's okay.
Thank you, Zoe, and thanks for the invitation to be here. I think we're all aware of the scale of rough sleeping in London at the moment. We've all seen the encampments that are in central London and in other boroughs. And colleagues will have more data on the scale of it, but I'm quite interested in the depth of it, if you like, and the experience of homelessness that people are having. And so we're seeing significant levels of distress. And in our research and investigation documenting how and why people are dying whilst homeless, I'm sorry to say that we now document 55% where we know the cause of death are deaths of despair. These are deaths that are due to suicide, overdose, other forms of death linked to drug and alcohol use. And I think it's quite clear that those deaths are preventable, should be preventable, and the policies since the 2010s are really coming home to roost and causing people to have extreme distress and many, many struggles. So that's what I wanted to share first of all, is the type of homelessness and distress that we're encountering in our research, but also on a day-to-day basis at the museum. It is very acute.
Thank you. That's really stark, and I think just shows the importance of having you to share that and for us to be looking at this as a committee. Thank you. Great. Similar question about just the factors driving the recent rises.
Thank you. So, yes, in brief, we would see rough sleeping as not just a housing problem, but much more broad than that. Rough sleeping and homelessness are very closely associated with poverty, but we would look on the rise of rough sleeping as a systems failure, and clearly the backdrop is of sustained rises in the cost of living, so it's very putting great strain on people living on low incomes, and we've seen the unravelling of many of the support services available to people in these circumstances. But really we're seeing in London and across England misalignment of systems that should be there to support and prevent homelessness, and we see the challenge as trying to build more effective systems that align, particularly at points of a failure where people are much more likely to be at risk of homelessness.
Thank you. Sophie.
Yeah, thank you. I mean, I would echo what we've already heard. I think for us,
it's both, it's a sort of push and pull. So there are the big systematic drivers of homelessness that we're seeing driven by policy decisions that are being made at both a national and a local level, but also the reduction in capacity to then support people off the streets. That's leading to more people being stuck, that kind of growth in the what we call living on the streets population. And I think that we are seeing increasing policy decisions being made in government departments which are contradicting ambitions to reduce homelessness, to reduce rough sleeping. We can look to, at the moment we're seeing big increase in people coming out of the asylum system into rough sleeping. There are policy decisions being made there that are directly causing that increase. Likewise, challenges with certain welfare policies. So we're seeing that big systematic policy decisions that are definitely driving increases in rough sleeping, but equally different decisions being made at a local level that are causing different outcomes in different boroughs. We don't see, it's not universal across London that we're seeing those rises in rough sleeping. So also where that's playing out locally. And as I say, then the challenges in resourcing and funding the suitable support needed to actually help people off the streets or prevent them from being on the streets in the first place.
Thank you.
Yeah, thank you. I think everyone on the panel already has given a lot of the context for the increases that we've seen. I think what I wanted to highlight on is, what we actually saw during COVID and the Everyone In campaign was a significant reduction in the number of people rough sleeping. And I think, unfortunately, that since the end of those policies, we've seen a return to those higher levels, and that those policy changes are having a more acute impact, particularly alongside things like cost of living pressures, increase in rental costs, all of those things. I think, as Sophie was saying as well, what we're seeing is that looks quite different across different London boroughs, and that's dependent upon the cohorts that are on the streets and the cohorts that local authorities are attempting to support in, statutory homelessness services, temporary accommodation, things like that, that we're seeing a cohort who are on the streets, not only the numbers increasing, but the complexity of the clients that we're working with. So St. Mungo's runs quite a few outreach services, and we're seeing that group of clients who we were to be saying as like living on the streets or entrenched rough sleepers, we're seeing that number grow, and we're seeing a group of people. So, for example, the target priority group, which previously referred to as the T1000 group, those really complex folks living on the streets with interrelated multiple disadvantage and intersecting needs. That cohort is still very much on the street, and I think that the specialist provisions is often what's first to go when decisions need to be made about where resources are allocated, and that's causing issues and leading to that that entrenchment of rough sleeping, and we're not seeing the throughput that we may have seen in previous years.
Thank you. Just as a follow-up, just in this section, I was just going to ask about the cause of risk, rising evictions in supported housing, and any possible preventative measures. I didn't know if anyone wanted to just comment on that briefly, and then we can move on. Yeah, go on, Jess.
Thank you. I was really pleased that this question was on there, because I think that there's a lack of skills and training and capacity to prevent people becoming homeless again. And I think the dehumanisation occurs across services. So I'll give you an example of what I mean. A person came to our museum site asking for help. He was on the 2-year rough sleeping pathway with Peabody in Hackney. He had been left to rot in a flat for 22 years. And at the time that he came for help from us, he was being carried up and down 2 flights of stairs to use the toilet, and he was an amputee, and his flat had never been adapted, and he'd been left without a toilet for 8 months. The fact that someone can be left in that complete state under the care of services, I found absolutely baffling. And what was happening was Adult Social Care and Peabody were framing a cuckooing situation as antisocial behaviour. So I think when we're thinking about why people are being evicted out of properties like that, quite often it's misuse of the Care Act because it's actually illegal to frame cuckooing as antisocial behaviour, but dehumanisation towards people who are living with addiction and who have a long history of rough sleeping occurs with professionals who don't have the right training and frankly don't have the skills to be working with our community. We've took that to the highest level with Hackney, and we work with the Safeguarding Adults Board to try and get some movement on it. We are working with them to resolve it and to support 80 of their social workers in trauma conscious training. So this change can happen at a structural level, and we are seeing better results now, but not, unfortunately, with Peabody. The same team are operating in the same way with other people in the rough sleeping pathway and just making the assumption that they are antisocial when actually they're trying to survive. So I think until we can change culture within large institutions like housing associations and local authorities, people are going to keep getting evicted back onto the streets when they really, really need the support and care.
We actually heard a similar reflection around cuckooing around disabled people from an Inclusion London roundtable we had yesterday. So it's really stark you saying that again today around that, misidentifying the needs. Did anyone else want to come in on Sophie, and then we'll move on? Thanks.
Yeah, I think it's important to frame this question as well within the context of we are in a crisis of supported housing funding. We have years of underfunding of the actual support element of supported housing. We have got new regulation incoming into supported housing because of challenges within the quality of supported housing, not particularly in London, but this is obviously a nationwide challenge. And a big part of that is how it's been funded. We lost the ring-fence funding supporting people over a decade ago, and there hasn't really been consistent resource going in. And that means that supported housing is often not equipped. The providers, the staff are not equipped to deal with the complexity of need that they're faced. We see a lot of services who are funded, for example, to provide quite low-level need support, but by the demands of the people who are presenting or having to accommodate people with very high complex needs, they are not equipped to manage them. They don't have the level of intensity of the support that they can provide, the qualifications, the skills, and that is resulting in people being evicted through systematic failures in funding and resourcing. And just to the point on adult social care, as well as mental health services, drug and alcohol services, the ability for people to actually access the support that they need once they are accommodated is also a huge problem. And the risk then sits with the providers. And if someone is, very unwell and they are struggling and they are accommodating lots of people and they have to kind of weigh up that balance and they cannot get them to the right support, whether that is getting, a Care Act assessment and getting the social care support, whether it's getting them into the appropriate mental health support, there's pressure points in the system. So it's bigger than just kind of looking at, I agree with all of Jess's points, but I think it is bigger than that, and it is looking at the interaction between that wider system.
Yeah, thank you. That was really insightful. Assemblymember Lord Bailey.
Good morning, Jess. I want to come to you on this idea of cuckooing and staff not being well trained. I used to be a drug worker, I used to be a street drug worker, and often I'd have a little sympathy for the housing officer because they just had a different view of the world. Their goals were different. They would argue that what they were dealing with was equally as serious as what I was dealing with. How do we go about cluing up those professionals? How do we go about sharing the burden? Because I couldn't tell a housing officer their need to defend people who already lived in the block was any bigger than my need to get this young man into the block, if something. So is that a case of just training, or do we need to swap roles? How do we get to that?
I think the idea of swapping roles is quite an interesting one. It's about dehumanised perception, which we've worked with scientists in UCL regarding this. It is a phenomena. When someone's overburdened in their professional role, a part of their brain won't light up, literally won't activate when they encounter someone in our community who is distressed, in addiction, etc. There are ways of working with that, so we can support less burnout, less dehumanised perception. It can be done through training and development. We need more resourcing, but it also does need to be challenged. In the multi-agency meetings that I've sat in, and perhaps due to the vast restriction in resources, perhaps since you were working in that role, no one else has been speaking up in this way and saying, hang on, we shouldn't talk about this person in this way. He shouldn't have been left, with an amputation and no care around that. So I think it is shifted a little bit towards the other way, and it does need challenging. Perhaps we need to fund community workers, resource communities a bit more so we can take care of each other, because certainly within the professional circles at the moment, I do think we are really lacking something, and the dehumanised perception is occurring and causing quite a lot of stigma towards our community.
Okay, thank you.
Thank you. That really resonates from my time in the NHS and seeing people lose that humanity from being burnt out. Assembly Member Boff with a question.
Ms Thursby, you referred to the COVID period and how everyone in worked. What would we need to do to recreate that now? Bearing in mind there's been an increase in funding from the Mayor during that period.
Yeah, that's a great question. So I think one of the things that worked really well with the Everyone In initiative was exactly that. There was a very low threshold for moving people into accommodation. So if someone was identifying that they were rough sleeping, they were given accommodation. I think right now, because of the strain on resources, there are verification tools that are being used that may lead to certain groups being excluded from housing options. So if we're thinking about some, underrepresented groups in rough sleeping figures, for example, thinking about women, it's not safe for women to be bedded down in very public places overnight and be found by outreach teams, verified on chain, and then have access to supported accommodation pathways. Those women might be, sitting in an all-night cafe, sitting on a night bus, sofa surfing with an acquaintance, and those women might.
Forgive me, I know the chair is going to attack me if I go on for too long. It's about reducing the qualification for being considered, being verified. This verification process.
We'll probably come on to that in a bit.
Yeah, I think we're coming on to that, but that's what you think is the biggest obstacle to recreating what we had in COVID.
Yeah, I think for me it is that I think that the threshold was so low that people were able to access resource and support, and then we met where they were at. Whereas I think right now there's a system of sort of cohorting people that needs to happen based on the available resource.
Okay.
And that then bars some people from accessing the support that they need due to that resource limitation.
Thank you very much for that.
We are going to come on to StreetLink and some of the other bits of this in a minute about some of this. I'm going to go on to Assembly Member Small Edwards for the next bits.
Thank you, Chair, and good afternoon, panel. Thank you all for joining us today. My question is open to you all, and it is, how are the demographic characteristics of rough sleepers in London changing? And what does this tell us about the drivers of rough sleeping at the moment?
I think that the most clear changes in demographic is from non-UK nationals who are rough sleeping. And so the single night count carried out at national level in England showed in London last week that I think 35% of people whose nationality was identified were UK citizens. Nationality was UK. 23% were from EU countries, and 18% were non-EU, I think. So this is a very big change. But anecdotally, we also see more women on the streets. Women's homelessness, street homelessness is a very different profile and is often less visible. But certainly, anecdotally, that's one of the big changes that we've seen.
Thank you very much for that, Greg. And just on the statistics, that's a national count, not a London count, right?
It's national. Sorry, I beg your pardon. It's 35% UK, 24% EU, 23% non-EU, and the remaining 18% were not identifiable. But that's national, yes.
Thank you.
What I wanted to add to that was the number of people who are being found rough sleeping after leaving asylum accommodation. I think that that is a very new cohort of people, and the latest stats say it's about 16% of new rough sleepers in London in 24-25, and that number fluctuates sort of with changes in policy, but I think that's a group that is quite new to a lot of our services, and I think we're trying to meet the specific needs of that group, whether that's, language support needs, other cultural support needs, but that's a change that we've seen.
Forgive me, it was London. Those are the figures for London I quoted, not national.
I would echo on people leaving asylum system, and that's both newly recognised refugees and also who people have had a negative decision, so who won't be eligible for support. Also, younger people, but also older people. We're seeing increases in both, proportionately increases in both populations. With the older people, that's not just a London trend, that is something we're seeing nationally, but as in ever in London, the numbers are larger. There's, I think, a lot more to be done to understand that, but a certain element is certainly due to the increasing number of older people who are in private rented sector. And that is going to be a growing problem as more and more less people are have home ownership, the growth of the private renter sector as a more insecure tenure, and obviously as people hit retirement, pension age, their income drops and then they are no longer able to afford. So that is an area potentially of growing concern, and there are not many services equipped to deal with the specific frailty needs or specific needs of an older population. And then, young people as well, so kind of both ends of the age spectrum and the specific needs of young people experiencing homelessness, and the particular barriers that they have for moving off from the streets. They have, additional welfare restrictions around housing allowance rates, shared accommodation rates that make it increasingly difficult to find suitable accommodation for people to move on to. It's already been mentioned in a previous question, but I think there's also an increased number of people who are already significantly unwell by the time they reach the streets. So with overlapping needs, whether that is physical health needs, mental health needs, cognitive disability, drug and alcohol needs, by the time they reach the streets, they are already significantly unwell. So failures upstream to prevent and to kind of meet these people's needs long before the kind of housing challenges present, and then they lose their home. But it then obviously makes it much harder to support people once they're then facing the additional trauma of homelessness, trying to engage with services. And I think that is definitely a growing population as well.
Thank you very much. And you explained really clearly there and really helpfully what's driving the rise in older people becoming homeless. Can I just ask what you think the biggest cause of the increase in younger people? Is it just broad cost of living concerns? Is there anything specific in terms of housing?
Yeah, it's quite multifaceted, I think, but there is definitely cost of living. We see a lot of young people where the household, so the family household, is not able to sustain a young person who's aged out of, for example, child benefit or the support, and that house can no longer afford to, to keep sustaining that child in the house, and so they have to move out, but they can't afford to move out, and that kind of falls through. Obviously, kind of intergenerational pressures, so family pressures is a big driver of young people becoming homeless. But I think it is often around affordability. So it is that pressure of housing affordability meets welfare, and where, cost of living increases, having an additional person in the house to feed who is no longer a child, they're no longer getting the relevant kind of benefits or support for that person, becomes something that's not affordable. It can create tension in the family household, and then the young person finds themselves kind of having to leave with nowhere to go. So we do know that is a big driver.
And just following on from that, I think that's condensed really well the emerging trends in the characteristics of rough sleepers in London. Are there any new or emerging trends when it comes to the location of rough sleepers? I represent the City of Westminster as part of my constituency. Historically, it's always been very focused there. I know that's still largely the case, but are there any changes in terms of where people are rough sleeping at the moment?
Yeah, I can speak to that a bit. So I oversee our services in Westminster, including the outreach team, and Westminster consistently has the highest number of recorded rough sleepers in the country. I think there's always that question about do people go to Westminster because there are services there for rough sleepers, or or our services in Westminster because there's a lot of rough sleepers. I think transit hubs are a big factor in that, particularly where we see people coming from outside of London. You know, someone shows up at Victoria Station and that's about as far as they go. So actually we've been doing some innovative work, working in Victoria and Charing Cross stations, having dedicated outreach support workers working in those stations. They're getting to know those clients, they're seeing people early on, and I think, you know, early intervention is so key, and where possible we're looking to reconnect people, whether that's you know, to a local another London local authority or back somewhere else, but yeah, sort of trying to meet people where they're at. So I think that trend is continuing in Westminster. I'm not sure actually in terms of other places in London, but I think, you know, London is definitely the driver across those trends across the board.
Westminster aside, which remains, as Gillian just said, the kind of the sort of epicenter of numbers of rough sleepers in London, it's actually the outer boroughs that we're seeing the biggest increases in rough sleeping. I don't think we know fully why that is. You know, is it because there's been concerted effort in some of the inner boroughs around, you know, their resourcing, there's more investment and there's more infrastructure and support available, that there maybe is less in outer boroughs, whether there is you know, some of that may be driven by where asylum hotels are and people kind of becoming homeless, you know, given that is such a big driver in increase in rough sleeping in London. But that is where that is a notable change in terms of patterns across the wider city.
I think it's really important to just underline the impact of the hostile environment, which just seems to be getting worse. All my colleagues have mentioned it, but we're really concerned about it because it exists in policy, and that creating of homelessness for people who are in and around the immigration system. But it also exists in the realm of disinformation. So we're often seeing far-right disinformation around homelessness and migrant homelessness, and using homelessness really as a weapon. So I think it's something that we all need to be like making concerted efforts with. In Haringey, we did have an asylum hotel, and we did some targeted work with Haringey Council Resettlement Team and Haringey Welcome, who are the local grassroots group who provide pastoral support for people in the immigration system. And we set up a three-way partnership with a community fund to provide first month's rent and deposit for people who'd been evicted by the Home Office. And that's housed 25 households, which is not big in the grand scale of things, but in Haringey's context it is, because that's 25 households who would have been rough sleeping in Haringey. So that's been relatively simple and effective, creative local solution with the three partners working together and meeting a specific need. So I would advocate for more of those kind of partnerships and rapid local response to problems that are driving homelessness like that.
I believe there's also a high and increasing rate of LGBTQ+ young people who are experiencing homelessness. Do we have any idea why that potentially might be?
We did commission some a policy paper on this area a couple of years ago, and there was certainly clear evidence in data of higher instances of homelessness in all its forms, not just rough sleeping among people who are LGBTQ+. There were a number of reasons, but sometimes insensitive or inappropriate services and commissioning of services was one. There's very poor quality data, which is a block in both commissioning services and tracking this issue. And so recording data about people's circumstances in a sensitive way is a really important step in order to create a clearer picture here. And some of the instances of family breakdown that Sophie's talked about can certainly be exacerbated when there are misunderstandings or just hostility to people because of their sexuality or their gender. So it's certainly an area that our research showed has higher instances of homelessness.
Thank you. And just finally for me, what is the current picture when it comes to rough sleeping amongst veterans of the armed forces?
Historically, this was one of the kind of great successes of policy decisions and policy into practice decisions. There used to be a significant number of veterans on our streets, used to be around 40% in London. It is now in the single figures, and I think that has sustained. There's a lot that can be learned from the success of reducing homelessness amongst veterans that could be applied to other parts of the system. You know, there is still more to be done. You know, it's not zero. There are certainly people who are sleeping on our streets who have come through the armed forces and who are kind of known to support services, and they've fallen through gaps. But there is lessons to be learned about the kind of the way that Ministry of Defence has kind of built in homelessness interventions and our funding. We have dedicated funding streams, Op Fortitude, and other things that are sort of specifically looking at making sure that we continue to reduce veteran homelessness. So we should, look to what has worked there for certain and think about that, how that applies across other populations.
Thank you. And just very briefly, I completely agree. And it's really important to understand and celebrate where we do have a record of relative success. And one reason certainly is that military communities take very seriously their welfare obligations and understand in many cases how to deal with respect with people who have a record of service in the armed forces and have done a good job. And some of the narrative washes over from other countries like the United States, where there's just a different pattern and a different profile of recruitment into the armed services. People who go into the armed services in America tend to be quite different to those recruited in the UK. And of course, we should remember that service in the military qualifies for priority need in housing as well.
Yeah, I visited a number of homelessness charities in my constituency. I visited a veterans charity as well, and that was the picture that they gave to me when I went and visited. So it's great to hear that confirmed here as well. Thank you. Thank you, Chair.
Thank you. A brief question from Assemblymember Lord Bailey.
Just want to focus on Westminster again and this idea of arrivals to London. Do we have any idea if London is a pull factor? Are people homeless elsewhere and think, well, I'll be better off in London? Do we have any idea of the level of that?
I don't think I have any specifics right now around the level of that, but anecdotally, absolutely. I think that particularly for folks who have maybe been placed somewhere, whether that's through asylum accommodation or, through another housing pathway outside of London, if that falls through, I think a lot of people just think, well, I'll get back to London because that's where there are things. And I think a lot of communities are here as well for people who might have those links and be searching for that as a route to end their homelessness. But yeah, we can try to look for some further stats on.
I've always wondered it because there's a myth that people are made homeless in Grimsby and they think, I'll come to London. I don't know, it sounds... I don't know, I just would like to understand that's true. And on the second thing...
Sorry, can I just respond to that point specifically? I think that's not... I don't think we're seeing people from outside of London come to London if they didn't already have some sort of link
that's
here.
What I'm trying to understand.
Yeah, but I think for people who, maybe they came through the asylum system, for example, and they got placed in asylum accommodation outside of London, that ends. They're likely coming back to London because they've got no connection to that community outside of London. I think we do see that as happening as a trend.
Right, that's what I want to understand. And just lastly on this thing about the outer boroughs, I've lived in inner and outer, and I've been speaking to a couple of homeless men in my borough, and one of them said to me it's because he doesn't get hassled. He said because the borough has very little work in this area and the number of rough sleepers is not so high, he feels a little bit more invisible and prefers that. And I wonder if that's something that you've heard before. Jess, Soph, anyone? I don't know.
I think people's experience of homelessness varies. Some people like to be near to services or in a group, and then some people do like to have a quieter life and try and stay safe in that way. People have a variety of survival skills. So I don't really want to speak to what I don't have evidence for, but I would imagine that it might be quieter in some of the outer boroughs than it is in Westminster, which can be quite a full-on borough if you're experiencing homelessness.
Okay, thank you, Chair.
Thank you. Assemblymember Boff.
Before we just move on, another brief question, if we may. I wonder if anybody's got any evidence of the trends of rough sleeping amongst women leaving prison, if that's if any of you have identified that cohort of people at all.
I don't have any specific data on that, but I would say definitely prison leavers is a major cohort that we see that, at the point of discharge, people don't have suitable accommodation for all sorts of different reasons. I think with short-term prison stays as well, that becomes a real issue. We do quite a lot of work in prisons trying to prepare people for their leave from prison and moving them straight into accommodation so that there isn't that gap in the middle where someone is sleeping on the streets before they're able to move into services. But sometimes, those short stays can really impact on the work that we're able to do while someone is in prison. I think for women, like we said, women are more likely to be homeless more generally. And I think that the true scale of women's homelessness isn't truly known, but I think programs like the Women's Census, so we're now annually specifically targeting women in a different way rather than going out and doing a street count. Multiple services in local areas are reaching out to women, going to places where women might be seen, and we're starting to now gather that data to get a true picture of what women's homelessness looks like, and I'm sure there would be a significant cohort of prison leavers within that.
Perhaps I'll move the subject, but keep the person. How effective is StreetLink's referral-based approach in addressing rough sleeping?
Yeah, so St Mungo's runs the StreetLink London phone line, and I think the self-referral line is something that we've seen real success with. So clients can call to the phone line directly. They can reach a staff member who, provides them with resources, reassurance, a listening ear, all of that kind of stuff. We are testing some more specialized casework on the StreetLink London phone line as well, which has shown some really good outcomes so far, showing that actually if someone is able to engage with support over the phone, we don't need an outreach team to go out and find them and engage with them on the street. We can provide that casework over the phone and end someone's homelessness in that way. I've got some stats. So
good. That's what I was going to ask for next.
This past quarter, we answered 2,398 calls and made 3,179 outbound calls. And that reflects the increased casework that we've been doing, which is up 10% from quarter two. We provided casework support to 64 clients in quarter two with 36 accommodation outcomes and 28 positive non-accommodation outcomes. And of the group of clients that were working through that test and learn model around the phone-based casework, 83% of clients were not seen rough sleeping again after an assessment. So that really demonstrates the potential of that type of service on rough sleeping more widely, and it's something that we're looking to expand.
Do you maintain statistics as to StreetLink's response time? So from the point of call to the point of contact? With physical contact? Or?
Yeah, so that would be dependent upon the outreach team. So the StreetLink referrals would go to that local authority outreach team, and then that outreach team, which could be sort of run by any number of organizations, they would be responding to those reports.
So you're the first point of call rather
Yeah, exactly. Although most of those outreach teams, they would have, key performance indicators around response times to StreetLink alerts. I think one of the challenges that we see, particularly with alerts made by members of the public, is by the time the outreach team gets that referral, that individual has potentially moved on, and we're not able to work with them or to follow up with them. So I think that's where that phone-based model can be a real resource for people who are able to engage with support in that way.
And Ms. Bubis, what about how effective do you think StreetLink is, and are there any challenges to the way it operates at the moment?
I can speak to this broadly. We Homeless Link used to run StreetLink, but we don't anymore, so I can't speak from a kind of operational perspective. I think one of the challenges is the difference between the sort of the app-based or the web-based model, and then the kind of interactiveness of the phone-based model. Obviously, London has that, and we see differences then in the kind of capability and intensity of response that you can see in other parts of the country. We do know one thing that can delay response times is when people are sleeping in kind of large green spaces, which is not uncommon, parks, which maybe sit across multiple boroughs. Because of the way that the alert works, it drops a pin, and that will apply to one borough specifically. So if you take Finsbury Park, it will be the borough that Finsbury Park in Google Maps is basically assigned to, which means that outreach team will get the alert. If they are the wrong team for where that person is, then that can cause a kind of knock-on effect of delay. And when time is obviously of the essence to try and to reach someone before they move on or before they disappear from that space, that can be a barrier. But generally, I think it's relying on resourcing the outreach teams and the effectiveness of them. But I think as a model, it is working.
May I just come in
Yes,
very
please.
briefly there? I think it's important to distinguish between the telephone-based support service and the rest of StreetLink London. The telephone-based support service is a service in itself, but the rest of it is a system connector, and so it can't work or not work on its own. Its role is to connect parts of the system, connect a member of the public or a self-referral to support through an outreach team, and so all parts of the system have to line up and respond in a timely and effective way for that system to work. But other than when direct device is given to individuals, it's not a service of itself, it's a connector. And
I think it either lives or dies by the fact that that's the title of the wraparound service is StreetLink. As far as I should imagine the users are concerned, is that correct? Or that's what they think it is, it's one call and they don't necessarily connect to all the different agencies who are involved in resolving that person's problem.
so just for context, the Centre for Homelessness Impact is part of the London Accelerator Programme, which I think you'll hear about in your next session. And as part of the work within that, we are looking at what we call the crisis pathway across London services, which includes StreetLink. So we're just looking at the model and how it works and what the outcomes are intended to be. But StreetLink is a discrete part of a system that connects other parts which operate independently, but are intended to align with it. So from a user's point of view, it may seem like one system, but it's connecting other parts of the system that could be funded by a borough, could be funded by a sub-region within London, or it could be funded by the GLA. So it's connecting different systems.
We've heard some criticism of StreetLink on the basis of that whole wraparound service that contacts have to be verified before action is taken. Ms. Turtle, that seems to be a problem.
I might be the only dissenting voice on StreetLink here in the panel, but
we like it when people disagree. Incidentally, we rather like it.
We do have issues with StreetLink. I think we have to ask what's it for. So I hear what you're saying about the phone line. I wasn't really aware of that self-referral phone line. But a report in 22 said that StreetLink was 9% effective at resolving people's homelessness. So we have to ask what's it for. Is it so that a member of the public feels like they're doing something and the data is being collected? One of the problems we have is it's non-consensual. Is there any other relationship in society where it's okay to report someone without asking if that's what they want and giving information about where they are into a database? Local authorities do use it to gatekeep reports from the grassroots. And I'll illustrate why I don't think it works with a story about Westminster. One night we were doing community outreach in Westminster. Some homeless women approached me and said, can you help this particular woman? We're really worried about her. It was her first night out, and she'd been targeted by a perpetrator. He was about to take her to his flat. So we successfully separated her from him, asked what she wanted to do, and she wanted to wait in Charing Cross Police Station for outreach because she felt safe there. So we took her there, made the StreetLink referral. At 3 in the morning, we got a response back saying that outreach couldn't go to the police station to collect her. She'd need to bed down. So obviously we didn't do that. We put her in a hotel and took things from there. But to me, that's just a clear example of how it's a system that simply doesn't work. The only way we could make the referral, although we're a charity working in homelessness, was through StreetLink, and then they weren't able to help her. So the way that we resolve people's street homelessness is there's two ends of the scale. One is a rapid response situation like that, where we have to be ready to take action there and then. The other end of the scale is through consistent, trusting, and compassionate long-term relationships. To me, StreetLink doesn't fulfil either of those things that the community needs. So that's why we just wonder, you know, what it's for and do we need something else?
It ties in, does it not, with the rapid response outreach service?
Yes, we shouldn't use it for SWEP. It's used for SWEP. How can it possibly work for SWEP when 3 days later the snow may have melted?
Yes. Okay. That's interesting. And in order to keep to time, unless there's a question you particularly want to see covered, I think we've broadly covered most.
No,
of
I think you're good. Yeah.
Yeah.
Thank you.
Thank you very much.
Assembly Member Lord Bailey.
Thank you, Chair. I'm going to start with Greg and then move on to Sophie, and then other people might want to get involved. What improvements could be made to the combined homelessness and information network, and how could the Mayor use this data more effectively to commission rough sleeping services? Mike.
Chain puts London at an advantage compared to other parts of England in having a more comprehensive way of recording individuals who are rough sleeping. But we still are a long way from having a data system which would enable us to get ahead of the problem of rough sleeping and profile people who are at risk of rough sleeping and indeed other forms of homelessness. There's a vast amount of data across London that could be used more effectively to identify people at risk of homelessness, held by individual boroughs but not shared routinely among them, some held by the GLA but held in different parts of local authorities. So, for example, a single borough may have information on a family in its housing data, but separately in its education and young people's department, in its revenue and benefits department if a family is in arrears with its council tax, etc. And bringing these together would have enormous power in profiling people to whom offers of support could be made at a much earlier stage and to prevent them coming into harm. And then if we think about beyond local authority data, what is held by health boards, by other public bodies, the prison and probation system. And when we talk like this, people often say, oh, GDPR makes this impossible.
I was about to say that to you.
It's widely misunderstood that GDPR puts in place a series of safeguards and then a series of steps and thresholds that have to be met in order to meet these improved need. But they are surmountable. It can be done. And in some cities in the United States, there are vast unified data systems that enable just what we're talking about, which is profiling people who are who data shows are at higher risk of homelessness, and then being able to offer targeted early intervention and support that would prevent their future homelessness.
I think it's always important to remember with Chain that it's only ever going to be as good as the people who are putting the data in, as the data that is put into it. It is essentially it's a data record system. So resourcing the outreach workers, the frontline workers who use Chain is always going to be kind of paramount to the success and the quality of the data. There has been, and I think this is really positive, a lot of improvements made recently to Chain to try and mitigate some of the challenges that have been sort of levied at it. Verification has been a big one, that people use verification on Chain as a way to gatekeep support. That has now been removed from Chain. Verification is gone from the system. It's no longer there, and therefore anyone presenting, whether they're at risk of rough sleeping or rough sleeping, should be recorded in the same way, and therefore taking that away as an option for local authorities to use, saying, well, you're not being verified on Chain, that shouldn't happen anymore. There's also been a lot of learning from the Women's Census around trying to improve visibility of women within the Chain database. So there's been additions to the locations that people can be recorded as sleeping in or being identified in. So they include fast food restaurants now, libraries and police stations, which were all identified through the Women's Census as areas that women are more likely to be seen in or feel safer being in overnight for safety. So there's a lot of work going on to try and kind of improve the gatekeeping elements of Chain and also improve its ability to identify some of those harder or less visible populations. They're also improving the capabilities to allow services to record caseloads and what they're doing, to shine a bit more light on actually what is the support being offered, which again is really insightful and useful information to help think about what are we funding, what resources are there, what services are available, what does that look like. And then in terms of utilising the data, improving accessibility and visibility of Chain data is obviously really key to that. I know that there's been work to develop better dashboards and sort of accessibility of data for local authorities and the GLA, visibility of that, online visualisation tools, with the hope that those local authorities are then using that data to inform their own commissioning decisions, their strategic decisions. And there's also been investment in the development of the Strategic Insights tool, which is pulling together data from different sources, so Chain, data from services who use Inform as a case management system. So it's triangulating different data to try and do some of what Greg was just speaking to, which is about better understanding where people are going after they've been spotted on the streets or been identified through Chain, because the follow-through is not good. You know, it sort of ends at the point that people get referred into a service. So trying to pull that together and grow that. That is a relatively new thing. The more data that we can get, the more systems that can be combined into that, the more kind of investment and resources, the better that will be. Will help us to have that visibility, that cross-sector understanding, that opportunity to think about prevention as well as where people are going for support and what that tells us. And I think all of that is about wanting to improve the usability of the data. It's there, whether services or local authorities, commissioners, decision makers, strategic decision makers understand what's there and how to use it is a different question, I think.
Okay, thank you for that. Very comprehensive. I'm going to come to Gillian quickly, and then I'm going to come to Jess as well. So I'm going to give you both questions, but the second part is mainly for Jess. What are the key challenges with Chain for outreach workers? And we'll speak to Gillian with that. And with Jess, is there any additional risks, concerns you have associated with Chain? So that I'll come to you after Gillian.
I mean, I think verification was the big sort of barrier that was highlighted on Chain before, which Sophie has addressed now. I think that Chain is a fantastic database. I think that it is an invaluable tool for outreach teams, particularly when we're thinking about, the distinction between London boroughs that have resources that vary based on the lines of those boroughs, that people rough sleep in different places at different times for different reasons, and actually Chain gives a unified system to share that information and monitor what's happening with cases, communicate about what's going on, and really provide a better level of support. I think, like Sophie said, we need to make sure that teams are adequately resourced so that they're able to input that data, and that data is dependent upon them having time for their admin and all of that kind of stuff. I think the other thing that I would say is what Sophie was saying at the end of her response as well. I think that we could really utilize Chain in a more strategic way from a commissioning perspective. So if we're basing, outreach team services on an annual snapshot rough sleeping count done in autumn, that might not reflect the reality of the rough sleeping cohort on the streets. Chain has that data. We can get access to that data, and I would really encourage local authorities to be using Chain data on a constant basis to review are the services that they're commissioning, are they fit for purpose? Do they have the right capacity? Are they thinking about the right cohorts? Do they have the right specialisms? Do we need to bring in additional mental health support, immigration support, whatever that might look like? I think that that's not something we're necessarily always doing, and I think it's a real missed opportunity because the data is there.
Okay. Jess?
I might be a bit old-fashioned on this, but I don't think that ending homelessness happens in a database. I understand the need for data in complicated systems, but we're not involved with Chain. We don't use Chain. I think that ending homelessness happens in relationship. I think for chronic homelessness, you can't resolve someone's homelessness without providing healing from trauma, safety, adequate resources, housing. Yeah, I think that it's important to have data and oversight of what's happening in, a population level. But let's be real, we all know what's driving homelessness. We all know what the solutions are. So sometimes I think we get tied up as a sector a little bit too much in the data, analysing the data, commissioning more research, all of this, when actually the answers are there, and it's about community, safety, relationships and adequate resources. And it really is that simple. And we see that every day on the museum site. We don't have any databases. We don't keep records of people. But often outreach workers and support workers can find their clients in Museum of Homelessness where they feel safe and where we can work with people on their own terms. So I think we need more community spaces like that and more real connection, not apps, not databases, but real relationship and real work.
But can you see the relationship between, if you're a politician, if you're a policymaker, if you're the bean counters, can you see the importance of understanding the larger piece so that you can focus on and fund the little piece? Like, one of the questions in here is chain of any use to find groups of rough sleepers who can be harder to find, harder to detail. They move around a lot. They're avoiding contact. Can chain help in that way? And I say that because the tension for rough sleeping is the public finance has a lot of serious demands. How do you present your case? Do you see chain and its ability to look at it strategically is an important piece of that, so that we can fund some of those relationships? Gillian?
Yeah, I mean, I think yes, because I think that we do need to have some evidence base so that we are targeting resource in the right area. And I think that chain is the tool that we have available to us to do that. And I think it does work in that way. Again, I think it's only as good as the data that is input there. And I think that it's about outreach teams being adequately resourced, because it's our outreach teams that know what's going on the streets. And if they have sufficient street coverage, they know who's in their patch, they know who's new to the area, they know who's where. And yes, there are outliers, but I think that, that insight, that local knowledge from our outreach workers who are building relationships with individuals who are rough sleeping, they're doing that work on the ground, they're putting that information onto chain, and then it can go from there in terms of resourcing teams better, and telling the story about the work that they're doing. So I think it's important from that perspective.
I'm just going to come to Jess one last time, because Jess, I have some sympathy with what you're saying, because I used to be a detached youth worker, and I was more effective than the local council because I wasn't concerned about anything other than, let's have a chat, where are you, I'm your guy, keep this relationship going. But could you see some use for some of this high-level data, just to maybe focus on some of the work you're doing, give you a start point to maintain some of the more relationship building that you're focused on?
Our start point is with the people, and people who are absent from chain, who are hidden, who people can't find, they're often with us,
right,
because they feel safe with us. Probably because we don't collect data and things like that, ironically. I think what I'm trying to say is we could scale and replicate community settings like ours to work alongside the large-scale population data. So we intersect into services as well. We're not like outlaws, but we're providing something that doesn't much exist, which used to exist, but it doesn't much exist now. And I'm sort of advocating for more of those community settings where people can connect in a way that isn't about their chain record, and the people who it's not for them to engage with mainstream services, they can feel safe in organisations like ours. I suppose that's what I'm saying. I'm not saying scrap chain, but I am saying that the sector gets tied up too much in population level data when we could be doing more and better work on the ground in relationship with people.
Okay, thank you. Chair?
Thank you. Thanks for your contributions there. That was really clear. Over to Assembly Member Cooper.
Thanks, Chair. Severe weather. The Severe Weather Emergency Protocol, or SWEP to its friends. How prepared, I'm going to start with Gillian and work down. How prepared are London's homelessness charities, bodies, systems, whatever you want to call it, for dealing with extreme weather? And we've obviously had, I think it's 10 of the last 10 years have been amongst the hottest. We've also had incredible flooding, and this is becoming more and more commonplace. So it's really quite important. Gillian.
Yeah, I mean, I think that SWEP as a starting point plays a very important role, and I think we need to remember what that role is, and that is, protecting those who are most vulnerable during particularly dangerous times. I think, our starting point, as I'm sure everyone on this panel would agree, rough sleeping is dangerous 365 days of the year, but it can be particularly dangerous at certain points of the year given weather and extreme weather, and that SWEP is ultimately a humanitarian response. I think that the provision varies across local authorities. I think that, so St Mungo's runs the Pan London SWEP, which is funded by the GLA. That resource has been there's been fair low utilization of that resource over the past couple of years. Now, we would like to think that that's because local authorities themselves are adequately providing the sufficient provision at the local level, but I don't know if that is the case. I think that there has been some movement away from maybe the core ethos of SWEP. And having tiered levels of SWEP and sort of having some verification or some, certain number of bed spaces only being involved or only being made available at certain times. So I think as a starting point, it's definitely something that's needed. I think I'm sure Jess is going to expand on this more, but I think, the data shows that we're using it exponentially for cold weather, and we're missing out on some of those other extremes. I think that also we need to think about the capacity. So SWEP might identify additional bed spaces, but not necessarily additional staffing and resources. So I think it's something that, our outreach teams are out, 365 days of the year supporting rough sleepers. SWEP offers a point in time opportunity to engage with people who might not engage at other points in time. So I think that's an important route, but I think we also need to think about what that offer is. So, not just being for one night, 3 days minimum is better, having that ethos of everyone in, which I think isn't necessarily taking place across the board with SWEP. And we would definitely advocate for that if someone is coming in for SWEP, that should be in for good, and that should be teams working to end that person's homelessness.
Thank you. I actually started with you because I've got a couple of questions for Jess when I get down to that end of the panel, following on from that initial question. Sophie, would you like to add to that, how prepared are London's systems?
Yeah, and I'm well aware that Jess will have a lot of insight to add here. So I think really just to echo what Gillian has said, I think it varies by London Borough. It's extremely weighted to cold weather. There is obviously now guidance for hot weather, but actually, what we see as extreme weather is changing, and it's changing rapidly. There isn't SWEP preparedness for heavy rains and flooding and high winds, which are equally dangerous. I mean, we've done research on the health of people experiencing homelessness, and one of the kind of most reported health problems relates to things like open infected wounds or issues with feet. These are things that are extremely hard to manage regardless when you're on the streets. But if you add in cold weather, if you are wearing damp clothes, this becomes a real health crisis. But we're not thinking about rain and heavy rain in the same way. So I think in that side, we're not prepared for the change in climate that we're seeing and how that is then impacting on our street population and people who are on the streets. I'd agree as well. I think there are so many missed opportunities with SWEP that we are bringing people in who are perhaps not engaging otherwise and then sending them back out onto the streets a day later, 2 days later, 3 days later. There is not enough integration with the wider system. And part of that is also down to bed space availability of the wider system. There is not enough then suitable supported accommodation, just houses, places for people to then go on to. And I think that means that, SWEP becomes this very sort of temporary thing in cold weather. It has a function to save lives in a very kind of emergency sense, but there's a huge amount of missed opportunities, and I think that point of everyone in for good should be the principle of SWEP.
A full disclosure, back before I used to do this, I used to be involved in running direct access straight off the street hostels, wet hostels, and separating people from wet shoes. I don't want to gross everyone else out on the panel, but I mean, obviously was quite crucial and was quite repulsive, and could lead to some really bad situations for people. And if you could actually persuade people to just change their trainers every 6 months, actually would also help with that situation. I'll come to Greg.
If I may, I'd like to answer slightly differently and just very briefly. Sure. The fundamental problem is a slightly different one, which is that our rough sleeping system is almost entirely reactive. It's set up to respond once people have reached crisis. And as we've heard, rough sleeping is inherently dangerous, and any sort of rough sleeping. And our priority ought to be to prevent it. And yet the infrastructure we've built up in London and elsewhere is to respond to it once it happens. And SWEP is an example of this. There's only so much capacity, there's only so much scope for leadership. And our view is that we should be reorientating this system towards one of prevention. So all these systems, crisis hubs, outreach, assessment centres, they're manifestly not doing the job intended. They're meant to be very rapid intervention to get people away from rough sleeping or prevent them from happening. And we know that the numbers in rough sleeping in London are rising and rising. The amount of money spent is rising and rising. And what are the outcomes? They are getting worse. So forgive me for taking it off topic, but our view is that we ought to be reorientating to create a prevention-focused system and investing the time, capacity and leadership we have in that.
Couldn't agree more. I mean, the only way that you can persuade people to change their shoes every 6 months, which I just sort of threw in at the end of my comment before I came to you, is by building a relationship with them so that you can help them change their shoes, because no one's going to go out and buy a new pair of trainers who's living on the streets at £120 a pop, are they? So it's that more proactive approach that I completely endorse what you're saying.
Let me just say that I completely agree about the relational nature of work, and it can happen upstream. We can engage with people when they are first in crisis, when they're first served an eviction notice, when they first get behind, first fall into debt, when their relationships break down. Those are the opportunities to prevent homelessness and other harms. And yes, that's a relational approaches are the great way to do that.
Absolutely. Jess, coming to you last on the general question about the homelessness system, but and whether or not it's ready for those moments of severe weather. But obviously you've just produced a report, and I just wondered if you could comment generally, but then also maybe share your key findings from your report.
Sure, I'd be happy to. We did found that half of the responding London councils were using verification. So I'm wondering if they've stopped using verification since we put the FOIs in. Because obviously verification shouldn't be used for SWEP. We also found that 90% of activations are still for cold, but there's recognition in the policy documents of other forms of extreme weather. It just hasn't filtered to practice just yet. We did find evidence of sit-up services being used. That was Hackney Council. Maybe other councils, we're not sure, but that is something that we should really abolish, sit-up services. I'm curious whether the rapid hubs that the GLA is funding are going to be sit-up services. And I think apart from the detail of the operations and what needs to be changed, I think what was really clear to us and quite interesting and really needs to change is this dehumanising approach that is disempowering, that is baked into homelessness systems and services. Basically, people sleeping rough, their views and their agency and their wishes are almost entirely missing from how SWEP is run. There's no professional curiosity for why people might refuse SWEP offers, to the point where mental health assessments are recommended, rather than the services or the council thinking, is our offer adequate? We need to reframe the idea of an offer to that of an ask. It's a big ask to ask someone to come in off the streets. are we making it the best ask that we can? We've published tools on that, drawn from what homeless people said was wrong with the SWEP offer. And then I wanted to just share an example from London Borough of Hounslow's published SWEP policy document, which they shared with us. In the document, it says, SWEP still acts as something of a draw for people who may not be sleeping rough, usually looking for a hotel. The challenge is to tell who is really rough sleeping and who isn't. At the moment, we're researching our next exhibition for the spring-summer. We're looking at how stereotypes about homeless people were created in the 1500s. This idea of homeless people being dishonest tricksters rather than people surviving is from the 1500s, and really it is time that we left it there and stopped constructing our services based upon the assumption that people are taking the mickey.
Wow, that's quite something from that Hounslow booklet. I'm a bit shocked. Well, I'll come to you then. What policy changes need to happen in London to address the effects of all kinds of extreme weather on people who are sleeping rough? And after Jess, if anyone else wants to indicate, let me know, unless she's covered it all.
We'd like to see, we would like to see practice, policy, but also the practice developed for the different forms of extreme weather with people who are currently sleeping rough designing it. So what do people need for extreme rain and what do people need for storms? Because it isn't just the same as a cold weather shelter activation. So a different service design is going to be needed. But as I say, with homeless people leading that. Infragood is something that, if it was properly resourced, could make a real difference. I think some councils are doing more with Infragood and are really, Haringey extended their SWEP, I think, for 8 weeks or 10 weeks after the January activation for cold this year, and they had some really good results with that. But it does cost money, so that needs to be resourced properly. And finally, if verification is still being used in 2026, we really have to stop verifying a humanitarian response and removing that from the system.
So thank you very much for that, Jess. So Jess has covered co-design, please, and the need for proper resources, and it not just to be policy changes, but actually changes in practice and the way that people operate. Do any of you want to add anything to that answer? I can see that Sophie's coming forward.
Yeah, I think it was. I agree with Jess, and absolutely the kind of co-design of what it should look like and the response. With hot weather SWEP, there was work done to develop specific guidelines that were sort of showing the difference of need and what thinking about things like sun cream and shade that weren't the things that need to be considered for cold weather. We have not done that for other forms of weather. So even there is less accessible, kind of visible, practical guidance for local authorities, but it needs to be more explicit in the policy documents. It can't just say you might want to consider this for other forms of extreme weather. It needs to be, directive. This SWEP must be activated for all forms of extreme weather, and this must include. We have very, very clear guidelines about what the thresholds are for cold weather. We do not have the same for other extreme weather, and I think that allows local authorities to be much more, to not necessarily activate it or to choose when they do or don't. And I think that is never going to change unless you have that top-down direction that says this actually, we're changing the definition of what we mean by extreme weather, and this is what the new definition is.
So one of the problems I have with it slightly is calling it extreme weather. So I think they said for about 6 weeks at the beginning of this year, there was somewhere where it rained every day for 6 weeks. It may not have been particularly extreme, but that's a long time. And I think they said in Aberdeen or somewhere in Scotland, they didn't actually see the sun because it was cloudy for about 2 months. I don't think they saw the sun until the 2nd of March. Does it need to be flexed so that it's actually lengthy weather? Because if it's hot for, not even if you say, oh, it's extreme because it's gone over a certain number of degrees, it's gone over 21 degrees or it's gone over 25 degrees. If it went over 21 degrees for 6 weeks or it rained solidly for 6 weeks, even though it may not be a massive rainstorm on any particular day, do we not need to also be considering that? Because the impact certainly of rain for 6 weeks is really not good.
I I think this actually speaks to Greg's point about the system, the SWEP being a part of a reactive system. Actually, we can't predict what the weather's going to do and how long. It starts raining, it's very windy out there. I don't know if that's going to turn into a storm or not. So kind of predicting how long something is going to. I guess the counter to that is, should we be having SWEP, or should we be having a version of SWEP that exists permanently all year round for people who are on the streets, and that is available for them, and that is co-designed with them, and that is connected to much more longer-term suitable forms of accommodation, supported or not. Because otherwise you end up with kind of a very flex system that could be there all the time. And actually, if we're saying that, being on the streets is dangerous, regardless of the weather. There are certain weathers that exacerbate it. So we should be looking to that instead.
Well, that kind of comes on to the next question, which is about how outreach services ensure that the demographics who are harder to reach, and we've touched on some of those, refugees, LGBT, youth, women, how do we make sure that they are being dealt with when there is extreme weather, whatever that means?
Sorry, can you just repeat? You're wondering about outreach, how the outreach team finds those hard to reach folks.
I mean, are we definitely making sure that even though it is a reactive system, that we're just disaggregating and saying actually that's not really the best way to do it, but given the system as it is at the moment, are the outreach services outreaching to all of the different groups that they need to, or are some people then still being left out there in the storm?
Yeah, I mean, definitely. I think people are being left behind for all sorts of the reasons that we've identified. And, the folks who aren't on chain because they haven't been seen by someone, and there's a reason for that. So I think there are tools that we are starting to use to tackle that. So thinking about the Women's Census as an example of that, where we're changing our method of engaging with people. I think a lot of the stuff that Jess has been talking about today, going back to that community hub model, I think from an outreach team perspective specifically, it's about making sure that our outreach teams are adequately resourced and that they are able to really lead the work that they see needs to be done, so that they're co-designing that model with commissioners, and they're not, if you're an outreach team and you're receiving dozens of public StreetLink alerts that you are required to go out and look for, that's a lot of time that you could instead be going to a hotspot that exists and people are there. So, there's creative ways that we can use volunteers to do some first contact work with StreetLink alerts. But I think ultimately, it's about giving the power to those staff, that a well-resourced outreach team, they know their patch, and that local intelligence is a key piece of the work that they do to make sure that they're engaging with those folks. But I think recognizing also that there are always folks who aren't going to come into contact with rough sleeping services, and that speaks to this wider idea about prevention more widely. And are we upskilling librarians, GP staff, all of those places? There's all of these systems that people might come into contact with, whether they're rough sleeping, hidden homeless, precarious housing. Those are the types of places where I think we can be doing more work around that education piece, so that we're catching people early, not waiting until people get to the streets, and that when people are on the streets, we're able to find them.
And would you say that the main challenge for outreach services then is resources?
I mean, yes, ultimately. I think that boroughs are so different. I think that's a big piece of it too. Your geographical patch can be very different. The changing cohorts, like we were talking about, some of the systemic issues leading to different trends in the demographics that we're seeing in rough sleeping populations, that can be a real challenge. I think the outreach teams are constantly adapting to that. So resourcing being a piece of that. But I think, as we've also said, the statutory services that used to have a lot more resource to engage with our outreach teams, we had a supported accommodation pathway that we could refer someone into. We had a mental health specialist who was maybe coming out on shift with us. We had women's only provision. Those are the things that don't necessarily exist in all places anymore. And that means a lot more of that pressure is on the outreach team themselves, and we're not able to find the right place for that client who is inevitably being stuck on the streets for longer than should be.
Okay. Does anyone want to add anything further to that, or have we finished everything that... Did you want to come back in, Jess?
I just wanted to add specifically regarding LGBTIQ people experiencing homelessness. I think it's really important to fund and resource specialist organisations. So, for example, the GLA does fund the Outside Project and the Trans Winter Night Shelter. And I think that's really, really important because people in the queer community may not feel safe to connect with mainstream outreach or go into mainstream shelters. So I wanted to add that in if we're thinking about particular demographics and how they may be more excluded. Specialism really is important.
Thank you. Thanks for adding that. Thank you, Chair.
Thank you. That was really, really insightful. Loads of recommendations there. Over to Assembly Member Small Edwards for our last section.
Thank you, Chair. This is to you all as well. Do you think the Mayor is currently on track to meet his target to end rough sleeping by 2030?
Shall I start on this side? I think it's a very ambitious target, and I think there are good things happening in the space, but I think ultimately, as we've sort of presented today, I think the system is disjointed, and I think actually if we look at the ways of working across the rough sleeping systems, I think we're potentially more disconnected than we've ever been. I think that the gaps between statutory and non-statutory services and the pressures that are on the housing availability, suitability, all of that kind of stuff, I think that we're in a very difficult position. With that being said, I think there's some really good conversations happening now that we've been waiting to happen for a long time. So verification, which we talked about today, but this wider move towards prevention, I think that is, again, something that it makes sense when we say it out loud. I think everyone's on board with it. I think what that looks like in practice is more challenging to identify, but we're doing some really innovative work in the space right now. So we're running some test and learn projects right now with the Rough Sleeping Prevention Project. That is a direct access hub that different bodies can refer into, so it's not coming through outreach teams. We've got links with local authority, housing options teams, health services, specialist rough sleeping services. We're referring people directly into that hub, addressing their homelessness there and then. We've got staging post-accommodation for longer-term support, and we're seeing really good outcomes of that model, and that's the type of stuff that I'd be very keen to see replicated and expanded sort of across the system. And I think the ability to be flexible and utilize the data that we have to change things on the go, and I think definitely working with our local authority rough sleeping commissioners, where we've got, where providers and commissioners are able to have conversation about what services can look like and develop those models together with input from clients. That's where we're seeing progress and seeing really good things happen in this space.
Go down the line. I agree. I think it's an ambitious target. I think there is always going to be challenges when homelessness and rough sleeping are driven not just by local policy decisions, but also national policy decisions. And we know that there are certain big national policy decisions being made that will undermine any kind of local intent. Which was going to make it challenging to meet that target. I think there are things that are really positive that are in the Mayor's plan. I think there is, there's things around housing-led models that are really innovative and, are pushing ideas that we're not seeing that kind of thought leadership anywhere else in the country. And London is often doing that driving of thought leadership, which is really important. There's a growth in housing first in London, where we're seeing decreases in other parts of the country, and that is really positive because we know that that is a model that, if it's resourced and invested in and delivered well, can really help support some of the people with most kind of entrenched, complex support needs. But I think one of the big challenges is how we are looking at rough sleeping and what we are then funding as a result. We do fund a lot of reactive intervention. We fund prevention, but I don't think we always ask ourselves what we're trying to prevent. So we say let's shift to prevention, but preventing of what? Are we just preventing someone from rough sleeping, or are we thinking more upstream, preventing people from becoming at risk of homelessness or risk of rough sleeping in the first place? the importance of bringing in that cross-sector working, cross-departmental working. Social care, adult social care needs to be playing a massive role. There's a lot of people with unmet health and social care needs who are on our streets. It is not to do, housing is part of it, but that is the kind of end game of a long history of trauma and unmet support needs. And so we're never going to sort of stop people becoming rough sleepers in the first place if we're not looking at that element of it and bringing those, those departments in to be accountable for the role that they play. And then I think the second thing to think about is the opportunities and the risks of the new funding allocations for homelessness and rough sleeping from central government. Local authorities now have a kind of a ring-fence pot. There's no longer the sort of separate siloed elements. There's a huge opportunity there for local authorities to think really strategically about how they could shift and think about things in a more joined-up way, think about the connection between rough sleeping and other forms of homelessness, that it's kind of not siloed, what they're funding, thinking about the support element of support housing. But there is also a risk that doing that will take money away from rough sleeping services because they're no longer restricted by something like the Rough Sleeping Initiative. So I think that that leadership will be needed from the Mayor to instruct that and to make sure that kind of local authorities are still delivering towards that plan. But huge opportunity there for big strategic, a lot more ownership of money. There's longer term funding and more certainty of that funding as well.
Yes, we should remember that rough sleeping is just one part of a much bigger homelessness problem in London, and so the number of households in temporary accommodation in London, or the proportion is 20 households per 1,000 compared to an average in England of less than 3 households per 1,000. So London is the epicentre of family homelessness as well as of rough sleeping. So London does face great challenges, but it's right that London also has strengths, and some of them are now the alignment of delivery systems to try and turn the system into one that's more focused on prevention. And this is why the Ending Homelessness Accelerator really is important. So we've got this fragmented system in London with 33 boroughs, the GLA, the sub-regions coming together to coordinate at a strategic level, and there is leadership there, and so it's going to be a great challenge. But London is doing the right things to align, to coordinate, and giving itself the best chance to get itself back on track towards ending rough sleeping.
Just trying to think of what I can say that hasn't already been said. I think that the strategy's good, like it's in the right direction. Do I think we'll end rough sleeping by 2030? Not how things are currently. I think we have to be honest about that, but we should still try and reduce it as much as we can. It was really good to see empty homes in the strategy, and I think we do need to focus on repurposing empty buildings. We do need to make better use of empty dwelling management orders, and it would be great if the GLA could find ways to help local authorities be more bullish with those. And I think we do need some sort of oversight and scrutiny into council and housing association voids. I think we've got a significant problem with voids. I think there's incompetence, mismanagement, in some cases negligence. I would love to see that as part of the empty home strategy. So that's what I would say. And then also, as I've said all the way through, let's resource communities more effectively, community organisations. I'm not pitching for money here. We don't take public money. But I would like my colleagues in other organisations to be better supported in the work that we do outside of commission services.
That's brilliant. Thank you all very much. Back to you, Chair.
Thank you. I did just have a specific question for the Centre for Homelessness Impact. So, Greg, I didn't know if you could just speak for a moment to the research that was recently published around the cash transfer project, so giving money directly to people rough sleeping. I know there's been many projects like that over the years with good outcomes.
So we're keen to try new approaches to ending and preventing homelessness, but then evaluating them as they go. So the project you're referring to, we recruited 250 people in London and in Belfast, of whom half were given in a random allocation a cash transfer without any strings attached of £2,000. That trial is ongoing, and so we won't know until a year after the allocation of funds what the outcomes were. And our key outcome that we're measuring is housing stability. But the early signs are really positive. We've had very strong recruitment and engagement with the research process. The sorts of people, the sorts of things people have spent the £2,000 on are really quite mundane, just sort of investing in themselves and their families, where they've got properties, just buying furniture, paying for training, sometimes not spending the money, as many members do, just saving and or giving money to family and friends. So that's encouraging, but we don't have full results from that. We have a separate trial, which is a different cohort of young people leaving local authority care, and we've given, this is with King's College London, the same sum, £2,000, to a slightly smaller group of 100 young people. We're about to publish the findings, and they're really encouraging. Clear positive impact on housing stability, so 8 percentage points increase in housing stability, lower instances of sofa surfing, better engagement with health services, less engagement with the criminal justice system, higher reported well-being. This is a year after the transfer. So we are really keen to see these sorts of experiments replicated with different at-risk groups. So if we're thinking now about rough sleeping, as we've heard, the sorts of groups who are at higher risk clearly are women, people leaving the asylum system, young people leaving care, other young people in at-risk groups, so if they're not in employment, education or training, for example, and people leaving institutions such as prison, or it could be inpatient mental or physical health care. So we'd really like to see that expanding, and there is an international evidence base that cash transfers do work in other settings, such as overseas aid.
Thank you, Jess. Just to come to you with my last question within the context of that, it's just when I was in my NHS job and we were doing homelessness care, at the end of the year they'd be like, what could we spend money on? And they'd try and kind of identify recruiting someone to do some mapping or, you know, like making a resort. And I'd be like, let's just give the money to people directly. So I just didn't know, I know you've talked a bit about getting money to community groups, but I didn't know if you had any comments on that.
Yeah, I would support resourcing people directly. From my perspective, as someone with lived experience of homelessness, grew up in a homelessness setting, I find it a bit disappointing, and it's not about your work, Greg, at all. I find it disappointing that we need an evidence base that if we give people who are homeless cash, they'll spend it on something worthwhile. And I think that comes back again to my statement about how systems are kind of like in some ways stuck in the 1500s. You know, let's trust people. There's incredible wisdom and creativity and survival skills in the community. You know, let's actually lift that up and really just resource people. When people's needs are met, magic can happen. And that's what we see every day in MOH. So let's just try and meet people's needs and see what can happen with that.
Oh, got lots of people coming in now. Thank you. I thought that was really powerful. Assemblymember Boff and then Assemblymember Cooper.
It's very, very quick because I know we're up against time. Mr. Hurst, when will we see that? I mean, it's quite exciting, the document that you described. When will we see that?
So
can we have a copy?
There are two separate trials, but yes, you can have a copy. We'll publish the cash transfers for care leavers next week, and I'll make sure the committee has a copy of that.
Look forward to seeing that.
Thank you. And Assemblymember Cooper with the last question.
Well, it's not really a question. It's just if we are considering making a recommendation about cash transfers, I don't like to rain on anyone's parade, but I would just mention Kids Company and the incredible situation they did get themselves into because they didn't manage the process of cash transfers terribly well. So I do think it is really important that if this is something that as a committee we're going to make recommendations about, which we might choose to do so, that we do bear in mind the issues that arose with Kids Company, and any recommendations should take into account the lessons that can be learnt from what went terribly wrong in terms of their cash handouts. I'm not saying that what you're saying isn't worth having a look at, and it may be something to make recommendations, but it is an area where we, because it's public money, we need to be certain that it's going to go to I appreciate.
I think
what
we
you're
give
saying.
public money to loads of people who aren't responsible with it on individuals. But
and I don't
I'm
believe
go over to.
I don't believe two wrongs makes a right, and we shouldn't.
No,
be,
I
shouldn't be doing that either.
I just think we put a lot onto voluntary sector organisations and individuals. Just from my experience in the NHS, that we don't put on like massive providers. But I do agree with you. We need to do due diligence. But I think what Jess was speaking to as well was where we can meet people's needs as well. And I think that's a good place to start. Assembly Member Lord Bailey.
I just want to echo the sentiments of Assembly Member Cooper. I think she's correct, and we do need evidence base because it's not our money; it'd be somebody else's money. And remember, there's other people who struggle who will watch us giving away money that they're not eligible for. So we must have a strong argument in order to satiate how they feel about life as well. I'd be very interested in evidence base for this. I think the Kids Company is just one example of how it could go wrong. There's been many others in the past. I do understand the power of giving people money.
We're going to have to,
but it's got to be a contact. No, I'm saying it's just important because if we're going to make that recommendation, I'm going to need my hand held through that process.
Okay, and we can talk more about it because I've got my experience of commissioning services, and I think it's where you look at where the money's going. Does it go to paying someone to support someone, or do you get the money directly to the person so they can support themselves? So it's the same.
Managing people's pain is how the middle classes pay their pensions.
But I think it's where we start with the need and then the service designed around how you meet that need. And I think that's what Jess and others have spoken to and about how we do that. Okay, I didn't realise that was going to invoke so many questions and comments. But thank you, panel. Thank you so much for your contributions. It was really insightful. I think there's loads for us to recommend and discuss with our second panel. I was making lots of notes for things to raise with the councils and the GLA who we've got coming after. So thank you. Thank you so much for your time. We'll have a short 5-minute break and resume in 5 minutes. Thank you. welcome back to today's Housing Committee, where we are discussing rough sleeping in London. Can I please welcome to our second panel of guests, Simone Millier, have I said that right? Melia, sorry. Head of Housing Solutions, London Borough of Camden. David Eastwood, Strategic Lead of Rough Sleeping City of Westminster. Molly Bishop, Lead Manager, Rough Sleeping GLA. And Ellen Storer, I'm terrible at pronouncing names, Head of Specialist Housing and Services GLA. Thank you. Thank you for being here. So we've got a number of questions. Our first ones are quite kind of broad, and then we've got some specific ones, but you will get an opportunity to dig into lots of these areas. So I'm going to kick us off by just exploring why the levels of rough sleeping in London continue to rise, and starting with Simone and David, just if you can talk about that, but any specific demographics in your respective boroughs as well. So I'll start with Simone, and then we can move down.
Thanks, Zoe. I think just thinking about the drivers of rough sleeping, I think there are probably some obvious ones that get talked about a lot. So housing unaffordability, cost of living, lots of reasons why people are moving into homelessness who possibly hadn't experienced homelessness previously. Also, I think there have been some real challenges in terms of loss of supported housing, so registered providers who are moving out of the supported housing market, providing challenges to us in terms of being able to secure accommodation and have the right types of accommodation for people. Also some big drivers, including lack of options for people who are multiply excluded. So I think one of the issues we come across a lot is that people have lots of different reasons why different types of accommodation are not suitable for them. They've been multiply excluded from different types of accommodation. And being able to find options that are suitable for people, that are safe for themselves and others, is proving a continued challenge for us.
And yeah.
Sorry, can you give an example? Sorry, just briefly.
So in terms of people who are multiply excluded, so we'd have people approach us who've possibly been through a lot of our housing pathways where they've been excluded from different types of accommodation for behavioural reasons or other reasons. Risks are too high, so we'll have people we come across who can't be accommodated in our borough due to risks to them and others. And I think reasons of kind of multiple exclusion, multiple disadvantage are stopping us from being able to have the right types of accommodation to support people sometimes.
Thank you. David.
Thank you. And yeah, and just building on that, I think that's where you look at kind of reciprocals between boroughs, and we do quite a lot of reciprocals between ourselves, Camden, Lambeth, other authorities, looking at where is suitable for someone, is quite often sometimes taking that individual out of their local borough accommodation which has failed them or they have failed in, and putting someone into a different accommodation can work. But that is quite a lot of work for us in terms of as commissioners. And I think as well as that, it's not just about rough sleeping, and that's when you have to factor in adult social care, public health, other support services, and trying to get those agreements across the board can be tricky in terms around it. We manage to circumnavigate that on a regular basis, but there is that proviso in terms of round, although we can work in terms of rough sleeping, the other services and the other wraparound services that the local authority are going to be responsible for can be tricky in terms of if you're moving someone who has been multiply excluded, who does have support needs that are likely to call in other areas of the local authority. Getting agreement within the local authority in terms of around that isn't as simple as you think it might be. The other area that I like to talk about is in terms of non-UK nationals. We do have a high number of non-UK nationals rough sleeping in London. In Westminster, we have a high number of Roma rough sleepers who are here quite often in terms of economic reasons rather than necessarily just accommodation and support reasons. And ensuring we have the right approaches and the right response to that group means we need to be agile, we need to move, and that's something that I definitely would say in terms of round, in my experience being in the sector for about 20 years, is the needs have changed of those people on the streets. The individuals we're coming into contact with, whether that's support needs going up, whether that's different groups, whether we can offer services, whether we can't offer services. We've done a huge amount of work in terms of round ensuring we can help individuals realise their status in terms of when they have unclear status. I can still remember kind of probably 7-8 years ago when it was kind of like shorthand, it's no recourse to public funds, someone's got no recourse to public funds. Actually, the reality is, with independent legal advice, we can help people regulise their status, but that takes time. And to do that, and whilst we're doing that, we can't always offer accommodation for individuals whilst that's going through. So I think that does, if you know what I mean, that has caused part of the reason in terms of why the increased numbers on the streets, as well as everything Simone's mentioned in terms around cost of living, everything else. It's the magnet effect of London as well. If you look at every other capital city, if you know across Europe, the numbers of rough sleepers are higher in the capital city. So we need to acknowledge that there is that magnet effect.
Yeah. Can I? Okay.
Thanks, Chair. You say the numbers are higher in London. Is that a magnet effect, or are we generating our own homeless population above and beyond? Because in the Arvik session, I asked the Westminster representative, does she feel that people are coming to London to be homeless? And she said there's very little evidence of that, unless they already had a relationship with London. So are you saying a different thing or a similar thing?
A similar thing. I mean, I think there's a greater, there's a kind of the greater London donut and people coming into the the centre from outside London. There are individuals that come from other areas of the country across, that is always going to happen. But the numbers from other areas are not as high. The last time we looked at No Second Night Out, stats, there weren't as many people coming from outside of London as you would anticipate. It was more coming from inland. But in terms of were they born and bred in Enfield and then have come into Westminster, or had they come down from somewhere else to Enfield, then come into Westminster? It's difficult to know without looking into each individual's history.
Okay, thank you.
Thank you. And Molly and Ellen, a similar question about levels of rough sleeping continuing to rise, but specifically to you, what is the Mayor doing to support particular groups experiencing a rise in, specific to groups? Because we go into kind of the policies a bit later, but if there's anything specific you want to include in the introduction. Thanks.
Thank you. Yes. So there's a wide range of mayoral services that are targeted specifically at people who are facing additional barriers to finding support and help and exiting rough sleeping. As colleagues have mentioned, focus on non-UK nationals and people who are migrants and asylum seekers or new refugees is one of those areas. So the Migrant Accommodation Pathway Service is an offer of support with some accommodation and access to legal advice attached to it, and a whole range of wider legal advice provided through the Mayor's specialist immigration advice service as well. And then we also have specialist outreach focused at the Roma community, whose experiences of rough sleeping and some of the drivers and factors there look different. And that team is led by by individuals, most of whom have got lived experience and are really kind of highly qualified in terms of engagement and support. There are other specialist services for young adults, the Youth Hub, for people who are LGBT, also for individuals who, also for women, we don't have a specialist women's service through outreach and additional support, but within the services that we run, there are specialist women's roles that provide more kind of gender-specific services. So, for instance, in the London Navigator team, so the London Navigator team supports over 250 people who have been rough sleeping for long periods of time. And within that, there are specialist women's-only support workers that provide more gender-informed care. So there's a range of specialist provision across mayoral services at the moment, yeah.
Ellen, did you want to add anything?
If I may, just kind of zooming out for a second on the kind of question of numbers, and of course within which there are kind of groups with particular needs. I think, as a system as a whole, I think one of the things we need to just consider is the homelessness system across London. So that's not just in relation to rough sleeping, but all forms of homelessness is kind of under such pressure and has so little capacity to move to prevention that in itself is a driver of these numbers, that people are reaching crisis before we can before the system is able to support them, and that's kind of partly what we want to try and make a change to in terms of our approach going forward. So I just want to kind of zoom out a bit on that sort of wider context in the homelessness system, which is seeing the system under a huge amount of pressure.
And that brings us nicely on to the next question, which is the Mayor on track to meet the ambition to end rough sleeping for good by 2030, which I think in the context of that, it leads on to that ambition. And then I'll go down the line with that question, if that's okay.
Yes, thank you. So absolutely, we are making good progress in relation to what is an ambitious ambition, especially in the context of numbers, of rough sleeping numbers being higher than any of us would like to see. You will, I'm sure, know that the Mayor's Rough Sleeping Plan of Action was launched last year, and that really kind of is centred on 3 kind of key interventions to support delivery of that target. The first is related to what I came in on just earlier around kind of the need for us to consider systems-wide approach to this issue alongside wider forms of homelessness, and show leadership and be in the leadership space along with boroughs and other and London councils and other key partners in the city, and we've already moving forward with that at pace through establishing the London Ending Homelessness Accelerator programme, which we'd be happy to talk about more today. The other 2 pillars of that plan of action are around prevention. So preventing people sleeping rough in the first place has got to be absolutely critical to our response. And we have done a lot of work and continue to do work to consider how we can deliver services that enable that prevention agenda, but also how we make sure the system work with all partners in the system to make sure we're all pushing in the same direction in that regard. And then finally, we recognise that there is still a significant need for working with those who do find themselves those people who do find themselves on the streets. And so the third plank of that plan is around supporting people with kind of rapid and sustainable routes off the streets. Progress very much underway. It is we still have a lot of work to do, but welcome obviously other comments here, but I'm kind of really pleased with the way in which we're seeing the system and partners come together since the plan of action was launched and all that we've got in store kind of in the coming months.
Thank you. And just briefly before others come in, could you just speak to how the consultation and what you heard in the consultation shaped or changed anything in the plan?
Absolutely. And I think this was it was a big piece of work. Putting together the plan of action, and a key part of that was the resource and time, quite rightly, that was put into engagement. We did a range of engagement. So we had a call for evidence, which received nearly 100 responses. We did a Talk London survey of Londoners, which received over 1,000 responses. And we established the Rough Sleeping Plan of Action Steering Group. So that includes 11 people with a broad range of experience and many years of lived, volunteered and worked homelessness experience. So through all those different types of engagement, we obviously got a lot of information through. I think the key, some of the key examples I would use are, the need highlighted across that call for evidence for us to take the systems-wide approach, which I've talked about, the need to support access to kind of specialist services, especially specialist accommodation services, some of which Molly has already talked about, the need to end the postcode lottery of it just depending where you happen to be, impacts the kind of service you get, so that's through the no wrong door approach. But I also say kind of one of the really key things that came through, especially from the lived experience side, was the need for us to work towards ending verification as a route into receiving support, recognising that that's an absolute cornerstone of prevention, but also in terms of kind of a person-centred approach that we don't want, we all know that rough sleeping for any length of time is dangerous, and we want to stop people doing that at all. And so ending verification for services is really at the heart of that plan of action. So they're just a few of the examples.
That's really helpful. Thank you. So, Molly, just any comments on the Mayor being on track or not to meet the ambition to end rough sleeping by 2030, and then I'll come to David in a minute.
Yeah, I think it's really important to emphasise, I think, this move away from verification or to end verification and the impact that we are hoping that will have in terms of being able to prevent rough sleeping and then also rapidly relieve it for people who are at the highest risk of rough sleeping for long periods of time. And I think we are making good progress there. There's been changes within our chain database system already. We have been doing a lot of service design work, working with partners across the sector and specialist organisations to map out and understand what kind of different pathways could look like in order to intervene earlier. And all mayoral services are part of that consideration. So I think the changes that we're going to see with regards to mayoral service provision over the next year, or certainly by the end of the year, we're hoping will have a significant impact on the number of people who sleep rough for the first time. We know that the real kind of evidential driver of this is that for the 38% of people who are new to the streets every month, just under 2,000 people, 70% of them are only seen once. And we know that with earlier support and advice, many of them would not have to have needed to sleep rough in order to get that. And that kind of culture and awareness of if you sleep rough and you call StreetLink and that there is an outreach response, we can circumvent that with the right messaging, with earlier support, and that is absolutely what we're doing.
Thank you. That was really clear.
Excuse me, Chair. Actually, not for me. 38%. I was a bit confused by those figures that you just used. Of the 38%.
Yeah. So of at any given time. So last month, for instance, there were 1,977 people who were known to be rough sleeping on the streets. 38% of those were new to the streets that month. They hadn't been seen sleeping rough before. Yeah. And we know that month on month of those people, only 30% will be seen sleeping rough again.
Got it. Thank you very much. Sorry about that. Yes, it's where I got confused.
Yeah, that was good. That was a good clarification. David?
Yeah, there's a lot of percentages there. I do think, and just building on what other colleagues have said, I do think that move from kind of crisis response, I think we've been focused a lot in rough sleeping on providing support to people immediately once they hit the streets, and trying to move that and shift that to providing support for people before they hit the streets, not having chain as this badge that suddenly opens up a different pathway to you, is something that we need to be adopting across the board, and it's something we're looking at doing very soon in Westminster. We've got our integrated singles and outreach service that's going to commence in April, where we're looking at bringing statutory and rough sleeping services together and ending this. If you go there, if you go to a day centre, you call StreetLink, you're seeing rough sleeping, suddenly a different pathway is going to open up to you. We need to be basing our services on need rather than on have you been seeing rough sleeping. But that is a culture change across the system that involves other partners and other areas of other areas and other support services also coming along board with that, because verification, and I've been long enough in the system to know, when chain was introduced in terms of verification was never supposed to be seen as a badge that got you into services. It was more a shared database that would ensure that across London you were aware if outreach teams were aware if you were rough sleeping in Camden and then you pitched up in Westminster, we already knew some information about you. It became a shorthand because of scarcity of resources to say actually only people that are verified can come into the pathway. So we need to be looking at what more we can do in terms of around that to remove this need. But working our way through that, we're going to need all partners on board with us. And I think in terms of the mayor, the mayor's target to end rough sleeping by 2030, I'd say, that's involving all the sector. That's involving boroughs. That's involving charity partners. This is not the mayor working on his own, going right. I'm going to be able to do that. And I think that's where we've all got to work together and be clear on what we mean by ending rough sleeping in London. We mean that it's going to be rare, brief, and it doesn't repeat. We don't mean that there will be no one sleeping rough in London. We mean when you are sleeping rough in London, we can help you get off the streets quicker, and we're going to try and prevent you from rough sleeping on the streets in the first place. So, yeah, that would be my 2 pence worth.
Thank you. Simone.
Thank you, Zoe. As colleagues have mentioned, I think there's a real opportunity. The partnership nature of working on this plan of action is a real opportunity here, because I think we know, having worked in housing for a number of years, that we can't do it without health, we can't do it without social care, and we can't do it without the voluntary sector, amongst others. So I think there's a real opportunity with the Mayor's Plan of Action for us to really come together and do something as a collective. And there are a lot of levers in the system. So we see a lot of stuff around like hospital discharge, for instance, and the real impact that we can have by working with the NHS to make sure that people don't get discharged from hospital homeless. So things like that, I think there are lots of levers that this programme gives us. Also, I think a few colleagues have mentioned the sort of relationship between statutory services and rough sleeping services, which I think, you know, for people who work outside of the sector might think it's mad that you'd have a rough sleeping service that doesn't sit with your kind of statutory homelessness service. But the way all councils are sort of structured differently, we all have different operating models. I think there's been a real kind of trend towards moving those services back together. So we don't see rough sleeping services as sort of enforcement services, very much support services, very much working with the same people who might approach us as homeless through that sort of statutory route. So I think that move for councils to kind of to put those services together and think of it across the piece has been a really positive one. But I suppose it creates that challenge of the scarcity of resources and needing to work out who we provide services to when we don't have enough supported housing. We certainly don't have enough social housing for everybody. So I think the plan of action gives us a real opportunity to work out who does what across London. So what makes sense sitting at a borough level, what makes sense sitting at a regional level across the GLA, and then I suppose nationally with MHCLG as well. And that's, I think, what's been a real benefit of having the accelerating, the EHAP programme that the Mayor's delivering.
Great, thank you. I'm passing over to Assemblymember Cooper now.
Thanks. I mean, obviously, one of the things that we often talk about in terms of the health services, preventative medicine, would take some of the pressure off A&E. And on the previous panel, we were saying how much easier it would be if there weren't so many people getting to the point where they start rough sleeping in the first place. So how do you think the preventative approach to rough sleeping that's outlined in the action plan is going to be implemented in practice? And I'll start with Molly on that one, if I may, and then I'll come to Ellen.
Yeah, so I guess elaborating on some of the points that I was making before, there's kind of two key routes that we are looking to take to implement this. The first is in that systems leadership, kind of no wrong door space. So we have a really significant role as the Mayoral Strategic Authority in supporting the boroughs and the wider sector and partners across health and probation and other spaces to be able to increase the capacity that they have for prevention. And sort of the approach that we're really taking is to help people to understand what works and to drive some of that innovation and learning ourselves, as well as trying to adopt it within our own services. So there's a sort of system side, which is about how do we do this together? How do we do it in a coordinated way? As you've heard, there isn't sort of an opportunity for one organisation or one service to turn this around. So we have been running a project called Crisis Prevention Pathways. So we've been working with boroughs, with voluntary providers, and specialist organisations to map pathways into rough sleeping, looking at kind of three key areas where we know that there's kind of a lot of pressure and a lot of people experiencing rough sleeping are coming from certain scenarios. We've been doing a lot of mapping. We've been looking at what kind of interventions there are across London for those individuals, where the points of failure might be, how they can be optimised. And then we're about to start a process of kind of testing some services to see how prevention might work better. And I think, it kind of comes down to the heart of the challenge that we are all kind of up for, but on a journey of understanding how we best prevent rough sleeping. Because essentially what we're saying is that we want to prevent single homelessness, and we want to prevent where people are already homeless from that becoming an experience of rough sleeping. So, this is within the kind of homelessness system, but also in a different space than rough sleeping services are kind of normally kind of thinking and operating in. So that piece of work has been really helpful in driving forward the conversation and bringing people together around the table to understand what's working, what different areas are trying. There's some really brilliant practice that's being developed from some voluntary organisations, providers, councils as well. So kind of really bringing that work together is a role that we are taking, and then really trying to kind of help scale that up And then, as I say, within the mayoral services themselves, really looking at kind of service design and how our resource is really maximising prevention, you know, how we are being outcomes-led with that regard, how we're kind of contract and performance monitoring in that regard as well. So those are kind of two key areas in which we're kind of putting our energy towards prevention.
I mean, the problem, of course, always with prevention is if you prevent something, it's quite hard to monitor what didn't happen, which is an issue. But it's interesting that you've approached it with mapping of what there is at the moment, speaking to a lot of partners and doing the service design, and now you're at the testing point. So hopefully that will give us a kind of a baseline so that we can say, OK, we were here and now we're here.
That's it. I think that's why the evidence-based approach is so important when it comes to prevention, because you need to have understood, if we did this, you know, would it have resulted in X outcome or Y outcome? But we can do that collectively. We can invest in that collectively, and we can do it, you know, a few times instead of all going off and trying to do it separately and building that case and building those models. So we think that's a really important foundational part to then being able to operationalise things that work.
Ellen, did you want to add to that as well?
Thank you. The one thing I would add to Molly's very comprehensive response is kind of maybe picking up on the conversation we were having just earlier about the how the consultation has fed into this. And I think one of the things that really came through from the advisory group, so those with lived experience, was about just how do people access information? How can they access the information they need to do the preventing? And I think, you know, that feeds into things like, you know, the priority within the action plan about the prevention phone line. So how we are getting people that help like as early as possible. And I think, you know, I think some of the guests who were speaking on the previous panel talking a bit about the kind of self-referral helpline option through StreetLink. So I think, you know, that idea about what is it that it's, how do we get the right intervention to the people at the right moment in the system that can stop that cascading of effect. So I think there's just a real kind of, that was a very strong message from our sort of lived experience group, and one that we're trying to carry through as we go through this process, including engaging them with elements of the service design as well as we go through.
And in terms of that accessibility then, very similar question to the one I asked to the previous panel then, making sure that it's getting to groups that are harder to reach, hardest to reach, and aren't necessarily as engaged with finding out about phone lines or StreetLink or, you know, anything like this, because people have got, you know, other things that are going on for them in their lives. Their focus is somewhere else. But also, you know, we need to be making sure that, you know, we're not missing out on providing a service for women or for LGBT or for young people or whoever it is, which group. And so we definitely, that's all been part of this process of testing and learning and mapping.
So yeah, absolutely. I think the point about reaching people who are as easy to reach is about what Molly was talking about. It relates to what Molly was talking about in terms of this happening in different settings where we wouldn't normally be having these conversations. So coming to people where they are rather than, you know, necessarily requiring them to go a different route. And I think there's lots of potential in that, and that kind of ensuring that we are getting people. If we're going to get people as upstream, get support to people as early as possible, we need to make sure that what we're offering is accessible. So that's, you know, at the heart of how we're going to take that
And
forward.
It sounds as though you've used groups of people, you've been lucky enough to be able to involve them who've got lived experience of rough sleeping, so they've been involved in all these discussions as everything has been developed. So they have been constantly there to inform the development of the Mayor's approach.
So we, in terms of the development of the plan of action itself, as I said, we had the steering group, the advisory group, which indeed contained members, including members with lived experience. We now have the lived experience advisory group, which continues. We fund an organisation called Groundswell to facilitate that for us, and we work with them. I think we meet monthly. Yeah. Is that right? We meet with the steering group monthly, and to kind of, you know, talk through with them kind of, you know, where we are on this, but also where identifying areas where we think that, you know, suggest to them where they may be able to input, and kind of we're working through with them at the moment about what that detailed input looks like over the coming year. But absolutely, we're kind of, you know, they have been with us on this journey and will continue to be so.
Thank you. I'm going to move on to a different area. It's one that I touched on earlier on, which is about severe weather and the emergency protocol. And I'll start with Simone and then work back down anyone who wants to come in. How prepared are London's homelessness systems for dealing with extreme weather? And you can speak either from your local perspective or more widely.
Great, thank you. I suppose, speaking on a local level, so in terms of Camden and how prepared I think we are, I think, we're really good at stepping up provision when it hits 0 degrees, so when we get the sort of cold sweep. So I think, very used to that kind of rhythm, that way of working, having things that we can step up when needed. I think there's a real challenge just in terms of numbers and being able to, certainly where, for boroughs who have lots of people rough sleeping in their borough, being able to step up severe weather provision at short notice for huge numbers of people is obviously very operationally challenging. And we've been quite good, at kind of harnessing the rest of the resources we have in the council, using, we use one of our libraries for quite a large shared sleeping space. So I think we're quite well prepared to step it up and do it. It's something that we're used to, and it's a great opportunity as well to get people indoors who may not accept accommodation options at other times. Also, I think there's always a benefit to having some pan-London provision. Often there might be people who you can't place in your own borough due to risk issues or other things. So having that pan-London provision that the GLA provides is really useful and really valuable to us as boroughs as well.
And so in terms of other forms of severe weather, for example, severe heat, do you have a sort of set response that you're able to swing into for that?
We do.
And also severe rain.
So for severe heat, we certainly do, and it's less accommodation based because obviously heat affects people much more during the day. So our response around heat would be very much around taking people water, hats, maps of where the water fountains are in our borough, sun cream, that sort of thing. And there is an accommodation element of that because obviously we would use it then as a way to engage people and try and get them an accommodation and get them indoors as part of that. And stepping up a lot of cool spaces. So we make sure there are places where people can go indoors where there's air conditioning. So for the heat, absolutely, we do that as well.
I'm guessing that Westminster, because you obviously have this sort of private fight between you to see who has the most rough sleepers. No, you don't actually. Westminster wins. Sorry, Camden. But you are far and away the two boroughs, I think, nationally that have the most people sleeping rough. So I think you're probably going to tell me that you're fairly well prepared.
Yes. Yeah. I mean, similar to what Simone has said. I mean, it is a huge amount of work. If you know what I mean, and it's a huge reliant on our partners in the voluntary sector to help us with it. And each, I have to say, especially during cold weather, and especially when there's prolonged periods of cold weather, I'm always amazed and astounded by how the voluntary sector, how our charity partners will step up and say, right, fine, yeah, we've got 50 people in, great, okay, we can maybe fit another 10 in, we can do this, we can open up a manager's office, we can do this, we can do the other. And I think that's what has to be acknowledged during SWEP, is the whole sector pulling together to try and do that. But the impact on the whole sector is, is outreach are going out, we've got more locum staff in, you're going to your outreach teams, those members of staff are working more hours than they should. After SWEP, there is naturally, occasionally, a bit of a lull. Your outreach team can't go out and deal with your street link referrals when you're saying, actually, can you target? I'm really concerned about X, Y, and Z, and we have a list of people that we're most concerned about in Westminster during SWEP, and we ask outreach to prioritise those individuals to try and get those individuals into accommodation during Tier 1, and then if it goes on for longer, we then look at actually broadening out SWEP to get as many people in as possible. So I would say, in terms of we are prepared. We will call SWEP outside of when Pan London calls SWEP. So we did. We have done that once this year when we were concerned that it was looking like it was going to be almost cold enough and there was threats of snow. We were like, right, we're call SWEP for our borough, regardless of even if Pan London aren't going to, because we want to get set up and be ready. So I do think there is that flexibility, and I think that's one thing that I think is crucial to know, is that yes, we all, as soon as Pan London's triggered, we are definitely calling SWEP, but prior to that, we can, as a borough, go, actually, we want to step up this provision. If there's concern coming from voluntary sector or from our voluntary sector partners going, is it going to be SWEP, is it not going to be SWEP? I'm always of the thing of going, let's just call it phenomenon. Right, yeah, if you're ready, if you're prepared and you're ready, yeah, let's do it. Let's call it now. Let's look at what we're doing. I think we haven't called, I have known of called SWEP for severe wind. I haven't known of called SWEP for severe rain.
Although, as I was pointing out, we had a massive 6 weeks of rain virtually every day at the beginning of this year, and although that's not a sort of severe incident, that's a very lengthy incident. Actually, that has really detrimental impacts on people who are outside continuously, quite often with the wrong shoes.
Exactly, and I think that's when you're looking at a local system to be stepping up more emergency bed spaces. You don't need to call it SWEP, if you know what I mean. We can just say we are concerned, if you know what I mean, we're concerned about individuals, we're concerned about this is happening. What more can we do within our pathway? What more can we do in terms of around this? I think putting the SWEP label on it, yeah, if you know what I mean, you might want to, but however, I still think as boroughs and areas, we're like, right, actually, we're concerned about this. What more can we do? What's happening in terms of the welfare of people that we're concerned about?
So coming to the, thank you very much, and that's been really helpful to hear from both Camden and Westminster on that. Coming more to the sort of all the other boroughs, if you leave Westminster and Camden alone for now, and then thinking about the Pan London response, how well do you think we're situated? And I don't mind whether both of you want to reply or whether Ellen or Molly wants to reply.
Thanks, I'm happy to come in first. We work with London councils to kind of agree and implement the Pan London SWEP protocol, which includes the activation procedure, which is that if on any night it is forecast to be, the air temperature is forecast to be 0 degrees or lower anywhere in London, we will activate call SWEP jointly. I think the important thing, and that process is, we have done a lot of work with London councils to make sure we're all totally clear on that process, but also that boroughs are totally clear on what that means, that by a certain time each day, they will know during winter whether or not SWEP is being called, and then that enables them to stand up provision. And as colleagues here have set out, kind of that is a very large task in some parts of the borough of the city. I think it's important to kind of recognise it's a consensus approach. So the really important thing about the Pan London activation process is that it has buy-in across the boroughs and from the mayor as well, to make sure we're all operating together as one system in terms of what is our universally agreed trigger. I think, as David has said, there can be other occasions when boroughs decide to make those local interventions, but we are, in terms of the work we've done to get that, our priorities for putting together that process and procedure have been about kind of absolute clarity for boroughs about when it is called and how. While still ensuring that we're meeting at Pan London level those meeting a humanitarian need, which is at the kind of basis of all of this. It's worth noting that as a matter of course, we work with London councils after every winter to review and reflect on that in the latest winter period, and during that time we have the opportunity to consider any kind of operational or strategic issues that have come up during that time, and whether there's anything we want to consider for taking forward into future SWEP seasons.
Do you think it's clearer the way it operates in terms of the cold weather? Because you were saying 0 or less air temperature at a certain time, but obviously heat it is obviously really detrimental as well. And the sun hats and the sun cream and water and cool spaces is absolutely critical. Excess winter deaths, excess summer deaths, both a well-known thing in health terms. Do you think it's as clear in terms of heat, and also the question about rainfall and responses around that?
So in terms of heat, there is guidance that has been published for local authorities in terms of recommendations and things they may wish to consider around how to support those communities during heat. So there is that guidance in place. I think on the other kind of forms of severe weather, there is an option within our policy that if there are very exceptional circumstances, we can activate SWEP during that winter period for other reasons. But in my time working on it, that's not happened, but there may have been times historically when we have activated for other reasons within that have met that threshold, but it is quite a high threshold.
Do you think there's enough being done to make sure that we're mitigating the problems that arise from severe rainfall? Obviously, it's been a big TfL programme to install SUDs, but we have found that there's been massive quantities of rain falling in very, very short periods of time that can be so detrimental for people who are in the street, and obviously things like paving over front gardens and endless impermeable areas in cities doesn't really help with that, does it?
So it's probably slightly beyond my area of expertise to comment on the particular drivers of that. But in terms of, as David said, there are kind of options locally for supporting people, those who are kind of who are living longest term on the streets will, have a connection to their local outreach services who will know them well and will be able to have that welfare in mind. But as I said, we will take that opportunity with London councils to kind of review, as we always do, the kind of operational strategic questions that have come up during the most recent period.
Thank you. Was there anything that you wanted to add to what everyone else has been saying, Molly, or are you content to let the severe weather rest there? David, you wanted to come back in?
Yes, just quickly. I think one thing that I think the kind of in for good principle in terms in relation to SWEP, and that's something that hasn't been mentioned, I think has been such a positive change that anyone who comes in during SWEP, until we will look to be assessing that individual and working out what the route off the street for that individual is. It doesn't mean they're going to be an accommodation for good, but it does mean that actually, as part of that, we've worked out what the route away from the streets is for that individual. And I can remember the days way back when where SWEP was literally activated, people came in, and then as soon as it finished, people left. And that was it. I think actually the in for good principle is such a positive, and I suddenly thought none of us have mentioned it, so I thought we should.
So making sure that it's part of a pathway and not just an event. Thank you. That's really helpful. Thank you, Chair.
Thank you. I was just going to ask quickly to maybe Ellen. When you mentioned you do the review of SWEP, is that just with councils, or do you take input from other organisations? And
it's a kind of internal facing process, but obviously we are aware of kind of wider conversations and any feedback we've had in terms of that process. So for example, I'm aware of the report published by the Museum of Homelessness very recently, and so it's elements like that we would obviously are kind of aware of the wider context and want to take all of that into account when we're doing that review.
Great, that's good to hear. On to Assembly Member Lord Bailey.
Thank you. I'm going to ask a question a little bit out of sequence, and I'll come back to my questions. How is Chain used to commission services? If I start with maybe Molly.
Yeah, so Chain, as you know, is a really rich source of data. We're really lucky in London to have such a long-funded, well-developed source of data, and being able to capture casework and individuals that are known to be rough sleeping, and looking at broadening that out with the broader kind of prevention view at the moment. Any service that's commissioned, obviously speak for the GLA, but I know that the same is true within boroughs as well. You carry out quality impact assessments, you look at the data that's available in terms of need, and Chain plays a really important picture within that. It's not the only source of data. We know that for many people, being seen sleeping rough may not be as likely. The Women's Census is a really good example of how you can supplement Chain data and also wider kind of qualitative research and people's lived experience as well. But Chain is really critical in supporting the quality impact assessment process for new service commissioning.
And you're really alluding to the fact that it's rich data because over time it's been kept up over time. Is that?
Yeah, and I guess how well embedded it is across all services in London, which is a very rare thing for, and how well connected it is. So it's a pan London, it's all outreach teams, it's all local authority teams, and individual user IDs, so you can see what people's experiences are and on off streets experiences as well. We also have a platform called the Strategic Insights Tool, which helps us match chain data to other forms of data, like supported accommodation, hostels, housing options, presentations as well. So we kind of use chain as a foundation for further insight by matching that across other data sets. So data and insight is a really, really important part of service design and commissioning, yeah.
Thank you for that. I'm going to come to Ellen now. What changes are being made to No Second Night Out programme?
Thank you very much for the question. I'm happy to kick off, but Molly is probably the one to give you a lot of the detail on this. But the key changes to No Second Night Out are transitioning towards a network of ending homelessness hubs. So that will see kind of the model, like, again, be a key part of the kind of the prevention focus. So enabling people to have rapid assessment, that they are able to have support for support in terms of next steps, and then kind of a clear route through from there. So very much building on the work of NSNO, but embedding it in kind of the new really prevention focused approach. But Molly, I don't know if there's more you want to add.
Don't feel obliged, Molly. If you have something to say, do, but don't feel obliged. Thank you, because your answer was pretty comprehensive. I thought that's why I'm saving Molly. I'm going to pick on Simone and David in that order. How do Chain and StreetLink operate in your boroughs, and are there any challenges?
So I think, as Ellen said, Chain, or sorry, I think it might have been Molly actually, it's Chain's quite well embedded across the system. So, all of our teams use them internally as well as our outreach teams. And the same with StreetLink. So because it's a resource that we all have, pan London, I guess it's valuable in that way because people are used to it. And that's in terms of the public, staff, residents. It's something that's known to everyone. I think there are some challenges with it. Despite that, StreetLink in particular can become a bit of a, it's the thing you signpost people to, and it's not necessarily, it's not an accommodation service, it's not necessarily a support service. So I think there's a bit of kind of confusion around what do you get if you refer someone to StreetLink. I think a lot of times people think it is an accommodation service, and it does get used a little bit as, if there's no other option for someone, give them the StreetLink number. So I think there are some downsides to having StreetLink, but I think overall, having a resource that we share, that we all know, that's known to people, and that's embedded across our system, like Chain, is really helpful for us.
Thank you, David.
Yeah, and just building on that, I think in relation to StreetLink, especially where we find StreetLink really useful in Westminster is where it's rough sleeping that's out of the way. So it's one of those where we're lucky in Westminster, we have quite comprehensive outreach teams. We don't need to know that someone's rough sleeping on the Strand, if you know what I mean. The team's out there already. But if someone is rough sleeping in a housing estate that we're not, if you know what I mean, that outreach won't necessarily regularly go to, actually getting that alert is really, really important and really crucial. So I think it is how you do, if you know what I mean, how you message that. And I think for outer London, I think, if you know what I mean, StreetLink is more important where you haven't got the, if you know what I mean, the outreach coverage. In terms of Chain, what I think Chain brings to us as commissioners is not just in rough sleeping. It brings us the evidence base that helps us with colleagues, if you know, in conversations with colleagues in public health in terms around drug and alcohol services. If you know, it helps us with colleagues in mental health, if you know, mental health services, to say, look, there is this unmet need. How can we do that? And we've got the evidence base to go, look, actually, this is who we're working with, and we can then also, hopefully, if we can get the right interventions in, measure the effectiveness of their services in terms of relation to rough sleeping. So I think Chain does provide us with that data, which you wouldn't necessarily get in other areas.
Again, to David and Simone, we've seen the rise of some what people refer to as tent cities in London. There was one in Stratford for a while. There's been one famously near Hyde Park. What kind of does that take a special effort to support? What kind of work are you doing, particularly around helping the people in any that exist and mapping where they could exist and trying to head off the need?
I think it's been challenging. It's probably the first thing to say, but I think it's also galvanised a lot of kind of support from across the system. I mean, David mentioned like health colleagues, social care. I think as we've tried to do more work to support people in encampments, as we've seen the sort of growth of them, it's allowed us to get colleagues around the table to support us to meet some of these challenges. So I think previously, when maybe it was a bit more hidden, when encampments didn't exist, the conversations we'd have with colleagues around the table would be maybe based on chain data. These are the needs people have. But now that it's so visible, or when it became so visible, it allowed us to then galvanise the support we needed. So to answer your question about our approach and whether it's different, very much so we've developed a different approach around encampments, very focused on where we know we've got an area with a lot of activity, trying to understand what the needs are in that area, to understand which colleagues we need, not only round the table when we have multidisciplinary meetings, but also actually boots on the ground outreach. So, for instance, we've got a social worker now who's mobilised to work with us on encampments, who can come out and do kind of Care Act assessments on the street. So I think it's, in terms of locally for us, we've really been able to sort of galvanise the support of our colleagues to tackle some of those really tricky issues.
Yeah, no, I mean, I'd very much echo what Simone has said. I think it is very, if it is tricky in terms of working in terms of encampments. It's tricky for partners. It can become tricky in terms of outreach, being able to access, being able to go in and provide assistance within large encampments due to their own safety on occasions. But I think the joint work that we do, and we did a lot of work with the Roma Rough Sleeping team in terms of the encampment, in terms of Marble Arch, in terms of providing support, but then also working out how you can bring in enforcement at the right stage in terms of around it, to ensure that we are trying to get as many people as we can into accommodation to get the support they need, but also to be outlining that we can't have we don't want to have large encampments across the city. This is not safe for the individuals there, and it's not safe for necessarily some of the teams having to go in and work there.
Thank you, Chair.
Have you got evidence of it not being safe? Is that something that people have experienced?
Yes. There's evidence of outreach to threat, not necessarily from the individuals there. Sometimes, there's threats to people that are in the encampment. So we had threats from passerby in terms of in Marble Arch. Had threats from people driving past and making threats, and and then potentially some threats in terms of within encampments. And encampment, quite often aren't safe places to be. So
threats towards the people sleeping there as well from people passing by. Yes. Okay, thank you. I did have another question there. Sorry. The ending homelessness hubs. Will they have? This was a question earlier. Will they have any sit-ups provision?
No. So the ending homelessness hubs, which will essentially transition from the No Second Night Out hubs as they are, the accommodation provision will look the same. In that there is communal sleeping within the hub itself, and then single room accommodation within the staging post accommodation attached to it.
Thank you. And on StreetLink, are you the right people to ask questions about the review? Obviously we've heard in the first panel, we heard the kind of it doesn't meet the rapid need and it doesn't meet the long-term need, and we've had a bit of feedback there from Simone. Is that something that you where does how often does it get reviewed? Do you look at the kind of, is that the best use of funding and that kind of conversation?
Yeah, so StreetLink is something that we are reviewing as part of the plan of action with regards to improving prevention and new funding round, so a new commissioning cycle. We think StreetLink's got a really important part to play as being a visible touch point within the system for people to seek help and advice. And also, as David said, the opportunity for members of the public to spot people who are out of your kind of usual outreach coverage areas. We do know, we can see the stats and the evidence of the outcomes from people's contact with StreetLink, what happens then when that is triaged through to different outreach teams or the Mayor's outreach team if that comes through at night. And we're aware both on kind of from a capacity perspective and also kind of what kind of advice and support is available, that there are opportunities for us to improve that service. So that's absolutely what we're doing in line with the kind of crisis prevention work. We're doing some work with St Mungo's at the moment to test different ways of operating the phone line. And yeah, I hope to see, those changes will be coming into force before the end of the year.
So what would you say is the key, aim of StreetLink? What's the key? Yeah.
The key aim of StreetLink is to make sure that people can get rapid advice, and where they are already sleeping rough, that outreach teams can be notified. But we know that at the moment, it's very much targeted. If you are sleeping rough, call StreetLink. There's no reason why that has to be the way round. People could be seeking that advice sooner. So we're keen to kind of help fill that gap and make sure it's not a route to people needing to then wait to be found by outreach and feeding kind of a verification system, but something that is far more available sooner, and therefore kind of the responses and the support that you might receive through that service can look different depending on your accommodation situation.
I'm aware we've got to move on to our final section, but I've got some other feedback I've had, which I'm sure you've had too, but I might send you some of the other bits and pieces that have come through casework and bits to you as well. Thank you. Just on to Assembly Member Boff for our last section.
Mr Eastwood, who's responsible for the rough sleepers on Oxford Street?
In terms of the response?
Yeah.
That would be myself and my team. Yeah.
Are you getting... how are you liaising with the Oxford Street Mayoral Development Corporation?
With the bids and that side of things, yeah, we have regular conversations with them in terms of around that group, yes.
Are they funding you in any way?
They're not funding me in any way, no.
Seems a bit unfair.
They provide the bid provides support in terms of to the outreach, to the outreach teams, but no, at the moment, and we're still in conversation, we're actively talking to them about what more we can do together.
Okay. Does the pedestrianisation of Oxford Street present any issues with regard to? It's already a centre where there is some rough sleeping. Does the pedestrianisation present some issues in terms of rough sleeping?
It's something I'll need to consider, Andrew, and we will need to work through.
And have you had conversations with the MDC over that issue?
I have not, no.
Have they wanted to talk to you about that issue? So they have tried to contact you about the potential for rough sleeping increases? Have
they contacted me?
Yeah.
Not myself. They might have contacted more senior members of the council.
Okay, thank you. Let's go on to the London Ending Homelessness Accelerator. The Mayor's committed, or rather the government has committed £3.5 million to this. Honestly, that doesn't sound like a lot of money. For me, it's a lot of money. But, it doesn't sound a lot of money, bearing in mind the scale of the problem that is trying to fix. So how much is the Mayor committing, and what is that going to be used for?
Thanks, Assembly Member Boff. I'm happy to come back on that. The 3.5 million which MHUG have provided to support the work of EHAP, as we're abbreviating it to, is primarily around, that's not intended to be the sum of all the funding we need to solve the problems that we're faced with, but it's more the sort of seed funding to kick off the work. So it's being used for a variety of things, including kind of resourcing the team around that work, but also funding some of the big bits of research work that are kind of fundamental to our intervention, so including the crisis pathways project that Molly's already talked about. So the 3.5 million is a small amount that's kind of intended to kind of kickstart the programme, but the it is important to be aware of kind of the wider funding position in terms of funding coming through government. So we are really kind of excited that we have had confirmed through the kind of local government settlement process and that we'll be getting funding for a 3-year period coming to the GLA. So that's across homelessness and rough sleeping. And that is intended to, a key job of EHAP is to kind of provide direction about like where we should be spending that money across the system. So that is around £25 million a year for 3 years. So it's not intended to, deliver all the services we need across London, but it is about...
Will it deliver any services?
It will deliver some, at some levels in government. And a key part of the programme is to work, and I think it was mentioned right at the beginning, I think Simone mentioned it in terms of the plan of action about making sure we're delivering the right interventions at the right level of government in London. So there will be, we think about that as kind of the regional and local, but also really critically here about the sub-regions. We think there's a real potential. We know there's growing potential. We're seeing it in action in terms of what sub-regional coordination and delivery can look like, and that's a key priority of this programme. So that funding is supporting interventions, including services at those different levels of government, and the key job of this programme is to develop the priorities and the plans, of which the Rough Sleeping Plan of Action is one, that will help direct that funding.
And who are the partners in this? Just everyone? Or
So it's chaired, Delivery Board sits at the top, as it were. So that's chaired jointly by Tom Copley, Deputy Mayor for Housing and Residential Development, and and Grace Williams, leader of Waltham Forest, but also Deputy Chair of London Councils and Housing Lead. So that's it's a GLA, London Councils kind of at the leading that, but in partnership with boroughs, London housing directors, with MHCLG, with partners across the system. So it is a true kind of systems-wide approach, being kind of led by London councils and the GLA.
And how will its performance be monitored?
A very good question. I'd probably hand over to Molly maybe to talk a bit about the shared outcomes framework.
So at the start of the programme, we established a shared outcomes framework, essentially kind of getting very clear on what success looks like for this programme of work. That is essentially looking at homelessness prevention, people's experiences whilst homeless, value for money, costs of temporary accommodation, some of the key things that are the key challenges that we're facing that the programme wants to address. And within that, so we've got our kind of key outcomes, what success looks like, and then a set of metrics that are drawing from different data sets to help us understand that picture. That is available now to the board, but we want to be using it kind of more proactively. But it will absolutely kind of form the central kind of focus for the programme's understanding of performance and monitoring going forward.
So if we ask a question in a year's time, we're going to get data back, we're going to see performance data.
Yeah.
Absolutely. Good. And do you have those targets at the moment for the accelerator?
We don't yet have targets. At the moment, the work that's going on is around baselining, so just making sure that we've got really good, quality baselining. But there is obviously opportunity to set targets as well, or aspirations, however they want to be badged. But I think the board is keen to make sure that there is a clear kind of position.
When can we expect the? I mean, is there published material? You've got a plan. Is that going to be published soon or when?
The plan is definitely to publish. We have not yet done so, but it will be soon that we'll be publishing relevant materials, absolutely.
Okay. Just as a final question, I think I've covered most of the points. Will rough sleeping in London next year be less than it is this year?
I absolutely hope that it will be.
Hope. Horrible word, hope.
Yeah.
It's an excuse for not doing anything. I mean, that's the aim, isn't it? If we're going to meet that 2030 target, in which year will we see a decline in the numbers?
We will continue to do absolutely everything that we can to bring down the numbers of rough sleeping in London to meet that target.
But you've got no particular profile of how that will come down, when it will come down, just 2030?
At present, yeah, we don't have a profile, but the target remains.
You spoke with some confidence earlier about hitting that 2030 target, but it doesn't appear as though you've got the data to back that confidence up.
I think our ability to meet this is kind of the sum of everything we've talked about today and all the work pushing in that direction. So, we continue to work with all our energies across the system to get to that point. And as Molly set out, we are doing the work kind of on the data and insight side, concentrating on baselining at the moment. But the question of how we begin to articulate that kind of going forward with the profile will be kind of investigated further as we go forward by the EHUP board.
I don't doubt your intent at all to reduce rough sleeping. Everybody wants to see it reduced. I've been rather a long time on this assembly, and we've had people in front of us before who desperately want to reduce rough sleeping. So how is it this is going to be different?
There is, I think, a very strong sense of support for the plan of action that the Mayor has set out in terms of the ways in which we will go about this, that sort of feels different and feels appropriate for where we are, especially with regards to a focus on prevention and also supporting kind of system-wide coordination and a no wrong door approach. Those two things haven't been addressed from a regional perspective with regards to work to end rough sleeping previously, and I'm encouraged by the support that we have across the sector that will help us move in the right direction.
Well, Chair, I'll hand back to you only to say that I hope that people don't come forward with the word hope so much, because we've had a lot of that over the years. We want to see delivery. Thank you. I
just had a question quickly on the Ending Homelessness Accelerator. So is it a GLA, like the Mayor and London Council? Is that the programme partnership? Is that who?
It is intended to be a system-wide partnership. So as I said, the chairs of the strategic board are kind of mayoral representative and London councils, but the board itself has representatives from across local government in London, from the sub-regions, from national government, not just MHCLG, but other government departments as well. And so recognising that needs for kind of systems-wide leadership, there is also a number of other kind of wider structures in terms of how we're driving forward delivery, which include, again, kind of representatives from across that system. So it's fully intended to be an absolute cornerstone of this systems leadership approach, and that we are kind of looking to our partners across different types of organisations to support in leading this change in approach and to help deliver those ambitions.
And how have you heard the voice of rough sleepers within that? How are you including those in driving that? So informing it.
The key way is from the rough sleeping side, is through the Lived Experience Advisory Group, which we talked about at the beginning. So the plan of action is the key. The rough sleeping plan of action is the key, one of the key ways in which we're driving forward our priorities in rough sleeping through the programme. And as I said, they kind of are involved, and we work with them kind of on a monthly basis to identify areas we might wish to work on in terms of further influence around service design, but also that plan itself is being influenced by feedback.
So the plan, just from my understanding, the plan's been inputted by people with lived experience. And then you've got the Accelerator programme, which is a board that's going to commission services which will be informed by that plan. That's the way that it's being. Is that the way it works?
So not so much commissioning services, but the kind of setting the strategic direction for how we think the services, what we think the best makeup of services might be in London, but that also in the process of further refining that and working through a delivery plan, we are.
I think I said that because the only information that we've got is that it's aiming to helping Londoners at risk of homelessness get support as early as possible. So I guess I interpreted that as providing services, but maybe that's...
No, that's probably just, the way that's kind of its overall objective, but not necessarily doing that itself directly, if that makes sense.
And I think that just comes back to, Assemblymember Boff saying that it'd be really good to see, some more detail of that. Assemblymember Lord Bailey.
Chair, what I'm going to say might sound quite harsh, but this idea of ending rough sleeping, given that people fall into rough sleeping for hundreds of different reasons, mostly human reasons, is it just sloganised? And I prefer David's approach to make it very rare and something we can, solve case by case. And I worry that this ending, this sloganising of it just sets us up to fail. I feel the same about the Vision Zero thing, I might add as well. But I just worry that are we being realistic enough in the words that we're using to make sure we get to a place where it's very, very rare. I don't know. I'm just saying, I've struggled with that the whole meeting because I've been homeless and it wasn't a decision I made. I didn't see it coming, and I don't know. It worries me. That's all.
I don't know if that's a question for anyone on the panel.
No, don't answer it.
Okay. I've got my own view about how you need to set a vision, but I do agree with you that sometimes we have targets that make people feel better, like ending violence against women and girls by X date. And it just, I've worked in the system where it just kind of makes people feel better for a bit, but you don't actually work towards solving the problem. So, but I do agree that you need something to, you need to have that driver. What a great place to end on. Thank you for all of your contributions this afternoon. I really appreciate it. I'm just going to whiz through some last bits of business. Can we note the report and today's discussion?
Noted.
Can we also delegate authority to me as chair in consultation with group party leaders to agree any output arising from the discussion?
Agreed.
The date of the next meeting of this committee will be confirmed at the annual meeting of the London Assembly in 2026. So thank you, colleagues. This is our last meeting. It's been a joy to chair the Housing Committee. I think we've done some really great stuff.
You've been a good chair. We've enjoyed you as the chair. You've been very good.
Great. That's good to hear.
Thank you very much, Chair. It's been great.
Thank you. So I have no urgent business, so I declare the meeting closed. Thank you.
Thank you, Chair.